Look at that. The powerhouse. All nurses dancing off.
Okay. And you want us to follow the board? The members follow the board? Okay.
Great dancers. Last 1 minute of the dance. If anyone wants to come, 1 more minute. Look at so much coordination, eh? Just don't fall. And the final 1 minute. Just 1 milk. Thank you everyone. Okay, let's begin. Our rocking CEO, please come back to your chair.
I got a meeting rock before the resolution.
Yeah.
Dancing. She's now going to dance resolution.
Yeah. Okay, let's settle down. Welcome back, everyone. Before we begin, welcome back, everyone. Please kindly settle in your seats. I know we are very energized today. Kindly take your seats. Okay, I hope you all had a great lunch out there, had some time to connect and network and socialize. So now we are going to get into the serious part of our business. But before we begin, I just want to call back on Maria Tandok to give her, yes? Yes, Maria Tandok, I'm going to give you 2 minutes. I'm not very generous, but 2 minutes is good time. Maria, I just don't want anyone left out. Is mic 1 on? Mic 1.
Hello. Thank you, Madam President. Maria Tandok. I'm actually talking as a member of the Mental Health Interest Group. As everyone had talked about, touring members' voices about self-care, I do want to just publicly say to Doris, I met you in 1997 at Mississauga Hospital. You did a forum there about RNAO. And Since then, I've become a family of this association. As everyone says, RNAO is a nursing association. As part of the self-care piece, and most nurses don't do this, I recently lost my husband, and I am so grateful. The family of RNAO, the nurses that I know and love and have been with for the past 25 years, over 25 years, have supported me. And I want to just say to the students that are here, being part of RNAO is much more than just advancing your nursing practice and getting more knowledge about where you want to be in your career in nursing. There's a lot of areas, but I do want to acknowledge Doris, the home staff of Home RNAO, Leanne, Carrie, Kumandini, and Alana, who I just met, who I knew from ICU at Mississauga Hospital. So that's really all I wanted to say. So thank you, everybody, on the bottom of my heart for being a nurse and supportive.
I knew where you were going now when you started to go. Yeah. And I didn't know she was going to talk about that, but I could see her eyes. Families know. Friends also know. So I want to say something to all of you, and thank you for letting us into your life.
Yeah.
Because some people close the doors in moments of pain. Please know this door, all of us, is open. Let it be open for you if ever you need. Please.
Thank you, Maria. And we make friends at RNAO, and friends become family, and this is home. So thank you. And didn't I say I saved the best for the last? There you go. All right. So I would now like to ask if anyone here today has any conflict of interest to declare, and to declare it now. No conflict of interest? Okay, thank you. Seeing none, we shall now begin the proceedings of the business today. So you can clap. Okay, I would like to remind the consultation representatives of the following. We have allocated approximately 2 hours and 25 minutes in total for the 17 resolutions, and we will dedicate a maximum of 8 minutes to each resolution to be able to deal fairly with it all. A motion can be introduced and seconded only by a consultation representative. I will first ask for someone to move the motion and then someone to second the motion. If the motion is moved and seconded, the mover of a motion shall have 2 minutes to speak. A mover can defer the 2 minutes to the submitter or an alternate. But we do urge that the submitters be ready at the microphone and prepared to speak on their own resolution. Anyone may speak to the motion on the floor, not only consultation representatives. However, preference will be given first to consultation representatives and then to other RNAO members, and only then to non-RNAO members. Consultation representatives are asked to use microphone 1.
Too much dancing, I'm sorry. This was the dancing. I left everything for dancing and just I didn't know. Sorry.
Consultation representatives are asked to use microphone 1 and I would say 3 and 1 only, just to be on both sides. And other members, please use microphone number 2 and 4, okay? So consultation reps at the front mics, and then the other members would speak to it at the mics behind. Please clearly state your name and the chapter or region or interest group that you're representing before offering your comments at the microphone. I also ask that a person speak only once on any given motion unless no other people are at the microphone. This way, we can ensure that everyone has at least one opportunity to offer their perspective. Lastly, I ask that you limit your remarks to not more than 1 minute. As I shared with you in the morning, that our Board Affairs Coordinator, Siobhan Cordell, right there at the back, will signal to me with a red colored card, when your time is up, at which time the microphone will be asked and I will ask someone else to speak. Motion forms are with the scrutineers, and the scrutineers are May Tao and her team, and they must be used to submit a motion or amend a motion. The forms must be signed by the mover with your name written clearly and include the name of the chapter or region or interest group, then signed by the seconder with your name written clearly, including the name of the chapter or region or interest group. Then give these forms to the scrutineer, who will give the signed form to the recording secretary. We will now commence with the consultation session for resolutions. We're all good? I now invite Betty Aldershaw, Chair of the Provincial Resolutions Committee, to come back to the podium.
It appears someone lost a ring. I'm assuming
yes,
this
I was
is why
supposed
it's here.
Yes, I was supposed to.
And no, that was not me dancing.
Doris, that ring was found in the bathroom. If
Okay,
someone
but
left
someone that lost a ring will know that they lost a ring.
it there. Yeah.
And will need to describe us the ring. Is that yours, Amy?
No, Corsitas.
Ah, it's Corsita. What
Yeah.
color Corsita? It matches your clothes, Corsita, as always you do.
Well done. All right, now the fun begins. Been looking forward to this, and I'm sure you all have as well. So before we begin, I would like to briefly explain the resolutions process. Members of the Provincial Resolutions Committee meet as required to receive and prepare, in accordance with our NAO's bylaws, resolutions for presentation to the annual meeting. Members of the committee collaborate as necessary with submitters to help them refine and finalize resolutions for presentation to the annual meeting. The members of the Provincial Resolutions Committee have the power to give preference to an affirmative resolution over a negative one on the same subject, eliminate duplications on resolutions submitted, determine the order of priority in presenting resolutions to the annual meeting, edit resolutions without the intent of the resolution being altered, and reject a resolution which it considers upon legal device to be in contact with the law, or which it considers to be a matter upon which action has been taken by, is under study by, or is beyond the power of the association. I will now read each resolution and we will deal with them one by one. Please note, first, each resolution as submitted has a whereas section and a therefore section. As we advised you at the resolution sessions a week ago, to provide more time to discuss the resolutions, we will only be reading the therefore, which is the actionable part of the resolution. The full text of the resolutions was included in your package. And second, for all the resolutions we will discuss, no known conflict of interest has been identified. Thus, I will not repeat this information for each resolution. So let's get started. Resolution number 1. Ending forced birth evacuation through Indigenous-led community birth and nursing advocacy. The submitter is Andrea Oh, sure, RN. So Andrea, do you want to get up to the mic? And I'll just finish reading it while she goes. Therefore, be it resolved that the Registered Nurses Association of Ontario advocate to the Government of Canada, Health Canada, and Indigenous Services of Canada for the phased elimination of routine obstetric evacuation and the funding and expansion of Indigenous-led community birthing services in the northern and remote First Nations communities. Therefore, be it further resolved that RNAO develop a nursing-led policy and practice framework to support nurses working in evacuation-based maternity systems, including training and trauma-informed care, Indigenous cultural safety, and advocacy pathways to support women's right to birth close to home.
So for the movers, seconders, and the submitters, kindly be ready at the microphone, okay? Can I have a motion to accept the resolution 1 as presented?
Michaela Harlan, Kenora Rainy River. I so move.
Thank you. Can we have a seconder?
Allison Norton, Region 11 Sudbury Chapter. I so second.
Thank you. We are now going to open it up for discussion.
I am not Andrea, but she asked for me to speak on her behalf today. Really, the heart and soul of her resolution is to support communities in building their own capacity and self-determination to have the right to choose where they give birth, especially focusing on low-risk births. I know this resolution focuses pretty strongly on the Sioux Lookout region, but this is a really important motion for all of Northwestern Ontario. Any questions? Let me know.
Yeah.
Carol Maxwell, Chair of the Sioux Lookout Chapter. Thank you for bringing this resolution forward. Respectfully, I have a few questions and would like to clarify the following. Prenatals who come out at 38 weeks gestation are from fly-in communities, not ones with easy road access to advanced health care. In the event of fetal or maternal distress, what would be the plan for medevacing the woman to a facility able to accommodate an urgent delivery? Air transport would be required and is not unrealistic to wait 8, 12, or 24 hours for a plane to get to the community through Orange Ambulance Service. If immediately available, sending a plane would realistically still take several hours. These isolated communities are not road accessible except by winter roads for a few months from possibly the end of January to March, and even at that it can take 12 hours or more to get to the hospital on winter roads that are just through the bush, like you have to bring your own gas, there's nothing in between. Would there be a second health provider at the time of delivery, or would the midwife be working alone? Was Indigenous Service Canada consulted or collaborating with this proposal, and are they prepared to back up if there are any issues regarding the delivery and the newborn? Many homes do not have running water and can also have issues with overcrowding. I appreciate the delivery in the community by the midwife would be for low-risk prenatals. I also understand how difficult it is for expectant moms to be away from their home for 2 weeks prior to having the baby.
Thank you, Carol. I think the focus is on routine obstetric evacuation. Speaks about routine, I think, the resolution. So not urgent sections. Do you want to respond? No?
I understand what she's talking about, and that's really real concerns. This does speak to routine care.
Sorry, what is that?
But someone needs, not you or me or in the committee, someone needs to actually do that.
Yeah, okay. Can we wait? We'll take another comment, and then they have an amendment that was sent in. Yeah, Felicia?
Madam President, Felicia Joseph, Durham Region. I am in favor of this resolution. However, if it is the aim ultimately to eliminate the obstetric evacuation in the areas, I recognize that this will not happen overnight, And I would like to suggest respectfully that they transpose the both resolve clauses. So while we wait for this to happen, we need to train and support the nurses in these areas. It may be a matter of housekeeping. I don't think it could be an amendment, respectfully.
Okay. Paula?
Paul Emanuel, South Simcoe chapter. I also am in favor of this resolution, but I would say that our esteemed colleague from Sioux Lookout was more on the how to do this as well as the what needs to be done. And this is the thing about the resolution. We say we want this to be done and to look at the efficacy of it and effectiveness. And it may, as one person said, it'll take years to get there, but at least we get started on the path to what's fair and just for these people.
Okay, thank you. And any more discussion, comments? Yes? Paul Andrew, you should be ready there. You should be ready at the microphone.
Thank you so much, Paul André Gauthier, representative for the Clinical Nurse Specialist Association. Madam President, I'm maybe interested in seeing what the submitter had submitted for the amendment, because that may clarify a lot of the questions that we are having and we're not able to find. I will entertain a motion for the amendment that the submitter submitted, and then we can see it. If we don't like it, we can vote against it. But if it's good, I mean, I think it may help us to understand the bigger picture of the situation, because I understand the situation of the First Nation ladies that are pregnant. This is really delicate situation when they have to deliver ahead of time. Can I move the amendment?
So,
I need somebody to second
we
the
are
amendment.
trying to follow process, Paul André. The committee members or the resolution members is the people that have the amendment that need to present, not Siobhan, not me. You know what I mean? So if you have an amendment, offer it. If someone else has it, offer it. But we cannot have Siobhan or me. So someone needs to start.
Someone needs to amend, yeah, and bring forth.
Okay, I don't have the text for the amendment myself, so I cannot do that.
Maybe they don't want to amend.
Yeah, yeah. So
considering that, Madam President, one of the recommendations I will do is the collaboration that RNAO should do with the partners involved in order to make sure that we are speaking for the best of the women who will be facing this situation and not jeopardize their situation as the pregnancy evolved.
So do you want to make an amended motion?
No, I'll just make a recommendation for the consideration of the RNAO when they will deal with this.
So
Well, I gotta go there, no? No? So I'm understanding, by the way, so Tecumseh? Yeah, so I'm board member, but I'm also from Kahnawake Mohawk Territory, and I worked for over 10 years in the north and still work with the northern communities. I understand the resolution as speaking to a phased elimination of routine obstetrics. And that's a process that would take time. And I believe that a phased elimination speaks to what our communities, my community and many others, recognize as the process of moving towards self-government and caring for ourselves. If we're supporting a process that enables us to be able to do so, and this is an organization that understands, I think, the risks involved, the issues around safety, health and wellness in our communities. And so, in actual fact, if this is what we are speaking to and looking to, then I support such a movement and a support of this organization to do so.
thank you. So we have an amended motion.
So Rob Samuelak, Ontario Nurses for the Environment. This is the amendment that the submitter had done, and I had actually helped discuss this with her. So for the first, therefore be it resolved statement, that the Registered Nurses Association of Ontario, RNAO, advocate to the Government of Ontario, Health Canada, and Indigenous Services Canada for a carefully planned transition away from routine obstetric evacuation contingent upon the development and safe funding of Indigenous-led community birthing services and culturally appropriate maternal care. in northern and remote First Nations communities.
So Rob Samulak has moved. Rob Samulak, you moved the motion, amended motion. And can we have a seconder, please?
Elizabeth Strauss, I second. I also would like to make a request for access purposes that, Rob, that you give this to Siobhan to be able to actually put up on the screen, because I do not feel comfortable voting on it further without being able to visually see it. Thank you.
Yeah, so can we have a seconder? We've already had a seconder. And Siobhan, can we put up it's up there now. The amended motion is in front of the screen. Do we have a question on this amended motion? No? Seeing none, can we call for a vote for the amended motion? All in favor? Okay. No abstention? Anyone abstention? Anyone opposed? No? Motion is carried. Okay. Done. Now we'll be off to a good start. Resolution number 2. Oh, no. Original resolution. Yeah, okay.
As amended.
So now we'll have to make another motion as amended. Someone will have to move. Paula?
Paul Emanuel, South Simcoe Chapter, I so move the amended.
Point of order, Madam President. We already have a motion on the floor for the resolutions. We just need to vote on the amended resolution.
So we did, amended motion. So Paula has moved. Are you going to second?
Madam President, somebody already moved the original motion. It's already moved. We voted on the amended resolutions, and we had already moved the amendment for the first part. The two ladies over there moved the first motion, the first resolution. So now we're voting on the resolution.
Okay, can we have a seconder for the amended motion then? Paula, move.
I so second.
What?
I will just clarify again. The amendment is passed.
Yes.
Now we're back to the main resolution with everything. We just need a vote. As amended.
Yes. Okay,
Yes.
so there we go. So can we have a mover to move? To vote. Yeah, can we have the vote for? Oh my God. Yes, can we have a vote in favor? As amended. Yes, I guess it's passed. You know we have 17. It's going to be a riot tonight. All right. Betty.
Good work, everybody. So resolution number 2, the need for mental health supports in long-term care, submitted by Cheryl Forchuk, Wajma Soro, Lalu Sarajan, and on behalf of Brand Hellman Norfolk Chapter. Therefore, be it resolved that the Registered Nurses Association of Ontario advocate the provincial government to increase funding for psychiatric assessment and medication review such that people with psychiatric illness can be appropriately assessed within 1 month of admission or within 1 month of new unresolved symptoms. Therefore, be it further resolved that the RNAO advocate the provincial government for nursing consultations from advanced practice nurses to address appropriate nursing plans for patients with ongoing mental health issues that are not responding to the current plan of care within 1 month of the need for consultation being identified.
Can I now have the motion to accept Resolution 2 as presented?
Amanda Burkhart from Norfolk Haldeman chapter. I'm a workplace liaison, and I so move.
Thank you. Can we have a seconder?
Alicia Herkimer, Brant Haldeman Norfolk chapter, and I so second.
Thank you. Open for discussion?
Amanda Burkhart again here. I defer to Wajma Sorur to discuss this
Thank you.
resolution.
Thank you so much. Wajma Surur, Brant Haldeman, Norfolk chapter. Colleagues, nearly 40% of long-term care residents live with a mental health condition. And by the way, there are amendments to this resolution as well, and I believe they haven't been received for some reason, so please stay tuned for that. It's no longer psychiatric focused, it's mental health focused. So nearly 40% of long-term care residents live with a mental health condition, and so many experience depression. And yet too often care is delayed, fragmented, and reactive. Every day we see behavioral disturbances that are worsening, inappropriate medications, restraints, and isolation. This isn't a failure of nursing, colleagues. It is a failure of a multifactorial system design. Because when mental health needs are not assessed early, we shift from care to endless repair. But we know what works. When care is integrated, when nurses, nurse practitioners, psychiatrists, geriatricians work together, outcomes improve. So this resolution is clear and actionable and makes use of existing resources. Assess residents within 1 month of admission from baseline or new symptoms, and consult advanced practice nurses within 1 month when care plans are not working. And this is in collaboration with community partners and pharmacists. This is about timely intervention, clinical leadership, and dignity in care. Colleagues, I urge you to support this resolution. Thank you.
Paul Andre, you could really walk fast.
I know, Madam President. Thank you so much. Next year I should be sitting next to there.
I think you should put your chair there.
Madam President, one other thing I find is the word psychiatric. In nursing, we work in mental health, and psychiatric is more the medical model, so there's two components to it, but I would say the emphasis also should be in mental health, so just for consideration.
Okay. So,
Yeah, thank you very much for that comment. Yes, this was amended.
okay. Can we put who's going to move the amended motion then? No.
Amanda Burkhart, Brant Haldeman Norfolk chapter. I so move the amended motion. If we could get it up on the screen.
So Amanda is moving the amended motion, and what is the amendment?
There it is right there.
It's up on the screen.
No, that's not the amended motion.
No, the psychiatric should say mental health.
Yes.
No, psychiatric is mental. Yeah.
Yeah, this is not the amended motion. It's not just that. This is not an updated document.
Are you saying that you are...
Let me see, I have it. I may have it.
My colleagues who are CNS in psychiatry and mental health were clarifying with us that they should be using mental health instead of psychiatry.
We understand. Can you offer an amendment? Because that's where doing
Okay,
resolutions, we need to offer
amendment that
amendments.
we change psychiatric to mental health.
Okay. So Paul Andre is the mover for the amended motion, and then
Seconder.
I second the amended.
Paula is the seconder. Okay. Do we have any discussion on this? No? Can we call for a vote?
I have the amendment.
All in favor?
Okay.
With amendment, yes. Because I'm going to call vote again. So, yeah.
First in favor of the amendment that will remain. So the answer is you.
Yes. So, all in favor? Any abstention? Any opposed? It's carried.
No.
No? No? No. Now we vote on. Resolution as amended. So now we're going to vote. All in favor?
Wait, Elizabeth Strauss and Rick, I do have one additional amendment that didn't quite get there. I'd like to request, because we are only voting on the therefore be it resolved, that the specific setting of long-term care be explicitly added to the therefore be it resolved, because alone, we know that the intention of the resolution is long-term care. However, doing this in the community obviously looks very different. So, just to literally put the words, increase funding for mental health assessment and medication review in long-term care settings.
Elizabeth, I think that changes the intent of the resolution when we add the long-term care.
Dear colleagues, thank you very much. Those changes are reflected in the amendment, and we'll try and get it up on the screen shortly.
Okay, so do we have the...
So, can I clarify something? So you can put amendments to a motion as submitted. You cannot change intents of the motions here, the intent, because that's out of order. So it was about long-term care, it stays about long-term care. Psychiatric to mental health, yes, doesn't change the intent. It's a language that is used today, by the way. So it's very simple. If you are changing the intent, you cannot, because otherwise we will be working here on new resolutions for everything. So is that clear, more or less, for both?
Is the amended motion up on the screen?
It's coming. It's coming.
So, Siobhan, the only change you need to make is to change the word psychiatric to mental health. I can't see there, so is there already? Okay, good. Can you send Zina? Thank you. Yes. Yes, audio.
Is that?
That's it.
Okay, so the...
No, it's still the old one.
So you already voted on it?
Yes. No.
On the motion.
Yeah. So now we're going to vote on the motion as amended.
I have a point of order, if I can. I just want to clarify, in the past, we've been able to submit amendments between the consultation representative session and this AGM, and I want to clarify, if those are submitted to Siobhan ahead of time, are we able to move without reading the whole thing, or what is the process that we need to introduce those motions that were submitted?
It's just putting up. Yeah, so we voted in favor of the amended resolution. Now, as soon as she does it, we are going to vote in however you want to vote for the resolution as amended.
So it's the same, just think it's not read. It's the same.
On the amendment that was moved by Paul Andre, or the amendment that was submitted by the submitter?
No, the amendment that, well, 1 second. We assume, because you already voted, that the change, so the submitter put the two. Paul Andre moved, didn't offer, to also change mental health to psychiatric health to mental health. And you voted on that already. Done. Now you are voting on the resolution as amended. Yeah. Are you voting?
So I would like to make a comment here. As my colleague Elizabeth Strauss just pointed out, the intent of the resolution was for long-term care, and that is not in the therefore be resolved statement, which is what she had just asked for the amendment for, and it didn't go forward.
In the stem,
in
not
the stem.
In the title only. Okay, so that doesn't change the intent. Apologies. So,
we don't vote on the title, we vote on the resolution.
Yes, so it'll be in the intent. Yeah.
I understand. No, he's right.
Yeah.
Rob is right, but was not submitted. So what you're saying, therefore, Siobhan or Zina or Marian. Marian, can you stay there, please? Please do. Thank you. That the Registered Nurses Association of Ontario advocate the provincial government to increase funding for mental health assessment and medication review such that people in long-term care, thank you. Okay.
Sure.
With mental illness can be appropriately assessed within, etc., etc.
Yeah? Okay, so now can we vote on the resolution as amended once the resolution?
So,
There it is.
so we have sent the amended resolution, but
Yeah. We have 7 minutes, otherwise the resolution will die on the floor.
So, well, if it dies in the floor, it's then referred to the board.
Board of Directors.
So the colleagues on microphone 4 and whatever is there, 1, 2, 3, if you will speak and not allow the vote.
No, I'm not. I'm getting ready to move.
Yeah, let's,
So you call it point of order. I move that we vote.
yeah.
Yeah,
Yes.
that's what I'm here to do.
Call the question.
Can I be recognized,
Yes.
please?
Yeah. Okay, so I'm just going to ask for vote. Do you have anything related to this? Because
Yes. I'm just one word, like query, because I'm Mary Buhion. I'm from Dowsville Long-Term Care.
Yeah.
When you work in long-term care,
So I think in the interest of time, we need to vote on this resolution as amended. Can we call for a vote first? All in favor? And any abstention? Opposed? The motion is carried as amended. Yeah, but now we cannot talk on this resolution.
Yes, I know. Like, can I just make a quick comment? Like in the long-term care, we use the term resident instead of people. That's it. Thank you.
Okay, thank you. All right, let's move on to the next resolution. There's a lot of chaos, but I think it's good chaos because everyone is thinking really hard, including myself. Betty? Next resolution, Resolution 3.
All right.
Let's move on to Resolution number 3.
Nursing leadership and antimicrobial stewardship to address antimicrobial resistance in Ontario, submitted by Dorothea Service. Therefore, be it resolved, the Registered Nurses Association of Ontario advocate to the Government of Ontario for the formal recognition of nursing as a core pillar of provincial antimicrobial resistance and antimicrobial stewardship strategies across all sectors of care. And therefore, be it further resolved, RNAO advocate for the integration of antimicrobial stewardship competencies into nursing education, province-wide access to stewardship tools, and nursing AMS surveillance data.
Okay, can we have a motion to accept Resolution 3 as presented? To move?
Oh.
Mover?
Matthew McGuigan, Community Health Nurses Initiatives Group. I so move this resolution.
Thank you. Can we have a seconder, please?
Akeem Edwards, Brantford, Alderman, Norfolk Chapter. I second.
Thank you. Do we have, discussion?
Hi there. So this resolution is about nursing leaders saving lives. Antimicrobial stewardship is important to the work we do as nurses. Antimicrobial resistance occurs when microorganisms evolve to withstand antimicrobials that lead to reduced treatment effectiveness, prolonged illness, and death in the clients and patients that we care for. It also increases healthcare costs. It's estimated that 6 lives per day are lost in Ontario related to antimicrobial resistance. It will cost the Canadian healthcare system approximately $6 million by 2050. Nurses are leaders. We are the largest healthcare body in Ontario, if not in North America. We are the last point of contact before drug administration at the bedside. And now with recent changes to the Nursing Act, We now have the ethical obligation to prescribe according to best practices. Nurses are in the best position to collaborate with paraprofessionals, interdisciplinaries, and interprofessionals to ensure that patients and clients receive the best, most up-to-date, evidence-based care and treatment. We're key to antimicrobial stewardship. We have an obligation to promote health and save lives by supporting the best use of antimicrobials. Thank you.
Thank you. Seeing no one at the mic, can we call for a vote? All in favor? Okay. Anyone opposed? No? No abstention? Okay. Motion is carried. Thank you. This was a smooth one. Resolution 4.
Resolution 4, RNAO to reduce RNAO to reduce food insecurity among nursing students in Ontario. Submitted by Paul Chomez, Alison Kern, Deborah Lefebvre, Celia Piper, and Andrea Rochon, Hugo Tam, Jessica Thomas, and Jennifer Wade. Therefore, be it resolved that the Registered Nurses Association collaborates with others in identifying the depth of food insecurity among nursing students in Ontario. And therefore, be it further resolved that RNAO collaborates with others to propose solutions to address food insecurity among nursing students.
Thank you. Can we have a mover?
Heather Hamilton, Kingston Chapter, I so move.
Okay.
Lynn Herdzik, Windsor Essex Chapter, and I second.
Okay, thank you. Discussion?
Hello, my name is Celia Piper. I'm a fourth-year nursing student at St. Lawrence College in Kingston. I do just want to quickly point out that we did submit an amended version after the consultation rep sessions, and that's not what is displayed on the screen. I do want to say that food insecurity is not just about hunger. Stats Canada defines it as a spectrum. So that can be worrying about food, it can be compromising the quality or quantity of food, it can be reducing intake, skipping meals, or even going days without.
Celia,
Yep.
are you presenting the amended motion?
No, well.
Somebody has to
Do you
move.
have it?
Yeah, a
No.
consultation rep has to move an amended
First?
motion. Yeah.
Oh, my apologies.
Yeah. No, it's okay. Yeah. I will have to apologize a lot of times then.
Is someone present?
Yeah, a consultative rep is moving.
Yep, they're just giving me it so I can read it.
Okay.
Yeah. You sent it to Siobhan on Friday, Thursday or Friday.
This counts the issues.
Yeah. It's our 7 minutes.
Yeah, can you pull it up on the screen, Siobhan?
You
so
have
that I
it?
can-
Yeah, it's up on the
Perfect,
screen.
there we go. All right.
Yeah. Can you
There we
move?
go. Yep, Elizabeth Strauss, NREG, I so move.
Okay, thank you. Can we have a seconder?
Andrea Keller, Kingston Chapter, I second.
Thank you. Are we discussing questions on this one? Yeah?
Marlene Morrison, Peel Chapter. When I looked at this resolution, it seems similar to the one, Resolution 8, regarding advocacy for Ministry of Education, non-wage subsidy in clinical placement. I think when I read them both, it's coming from a financial standpoint.
I think a point of order. Now we cannot go mix two resolutions at this point.
Not at this time.
Yeah,
No,
because it's
I'm
already
not mixing it, but it seems similar because they're stemming from a financial standpoint.
Yes. Doris, you want to comment?
So at this point, you cannot change anything. I would suggest that when you start to discuss, in a discussion, which is what you're doing now, you say first, I'm in support of this resolution because, etc., or I oppose this resolution because of, etc., so people know what you're standing. And if at the end we will see resolutions that are similar, I am the one that operationalizes that. Please do not worry. So speak either in favor or against, and why.
Okay, thank you. Yeah, Celia, now, any other discussions? Celia?
Yeah, can I continue a few points? Okay. Give you the definition there. So I do want to say that this issue is growing. Campus food banks across Canada have seen an increase of food bank usage of 400% in the past 3 years. And nearly 60% of Canadian students are experiencing moderate to severe food insecurity. For nursing students, this burden is intensified. We've heard from nursing students that are skipping meals to be able to afford transportation to their clinical placements. We have heard from nursing students that are working 12-hour night shifts and then attending a full day of class the next day. And we know that nursing students are relying on low-cost, low nutritious food simply because they have no other choice. These are students not lacking commitment or budgeting skills. These are students that are trying to survive while pursuing a profession built on caring for others. This is both a student well-being issue and a nursing workforce issue. We can't expect students to thrive and join Ontario's workforce when they are doing so on an empty stomach.
Thank you, Celia. We have 1 more minute left. 1 more minute. Yeah.
Trinity from Hamilton chapter. This is a really important issue to me personally. When I was in 4th year, I was working 40-hour weeks or 40 hours a week for my clinical placement for free, and then I would work as an extern for about 24 to 34 hours on top of that for basically minimum wage. And then I had 2 other jobs as a tutor and a campus tour guide. And because of those jobs, I was very fortunate to not have to worry too much about those things, but this was less than 2 years ago. And so this is really an important issue to me because I don't know how I worked that much as a student, so.
Thank you. Now, in interest of time, I think we are going to call for a vote. All in favor of the amended resolution? Okay, thank you. No, any abstention? Okay. Anyone against? Motion is carried.
So on the resolution, Madam President. Thank you so much, Paul-André Gauthier from the Clinical Nurse Specialist Interest Group. I like the way that the resolution now stands because we're going to collect data, we're going to know more about everything that is involved around it, and we are in support of the full resolution.
Thank you, Paul-André. Now, we are voting on the resolution as amended. I'm getting there. We are now going to vote on the resolution as amended. All in favor? Okay. Any abstention? Okay. Anyone against? No. Resolution is carried.
So I do want to make a comment about process. We actually shouldn't be calling for a vote. We are not consultation reps, anybody here. So it went. But we need one of you, when you are getting close to the 7 minutes, if you don't want this to go, I mean, you may want, depending on what it is, you may want to send it to the board. You know what I mean? Because it's 7 minutes past, you need to send, it goes to the board, and the board disposes, is called, however the board wants, right? So the suggestion is when you want to move, be at the mic. When you want to second, be at the mic. Then it's a vote, and then if it's your resolution and you are very passionate and you don't want it to go to the board and dispose as the board wants, you are ready to call at 6:45 or whatever. You say, I call a vote.
Okay, thank you. Now we are going to move on to resolution number 5. Betty, resolution number 5.
Sorry. Resolution number 5, strengthening employer and system readiness to support registered nurse prescribing in Ontario, submitted by Ruby Amanasio in partnership with the Staff Nurses Interest Group. Therefore, be it resolved that the Registered Nurses Association of Ontario continue its advocacy, and in partnership with relevant collaborators, develop practical and adaptable RN prescribing implementation resources, such as a toolkit for employers and RN prescribers that complement existing regulatory and legislative requirements.
Okay, can we have a mover?
Paul Emanuel, I so move.
Maria Tandock, I so second.
Okay, open for discussion. Submit.
Thank you. I did submit an amendment. Can we put it up on board?
Okay, there it is.
Perfect. So we just removed the phrase such as a toolkit to keep the wording broad and more flexible. So the intent of this resolution, it's really about implementation support. So Ontario has already expanded RN prescribing, and many nurses are already becoming authorized to prescribe. However, what we're hearing through the RN prescribing community of practice is that many organizations are still not ready. They're still trying to figure out how to implement RN prescribing into practice. And it's not just something that we're hearing from the community of practice. There's actual research here in Ontario and internationally wherein they are talking about the same workplace and implementation challenges, which for me, honestly, the biggest takeaway from there is that training nurses is just one part of the process. Workplaces need to be ready to support the role. That's why this resolution came forward, and the goal is not to create one rigid approach because different settings are going to look different. They're going to have different processes. And so RNAO played a very big important role in advancing RN prescribing here in Ontario. And I think that implementation support is the natural next step to helping ensure that this role is actually integrated into practice. RNAO is well positioned to support knowledge sharing and practical implementation discussions.
Thank you, Ruby. Thank you.
Paul-André Gauthier, Clinical Nurse Specialist of Ontario. I speak against this resolution for a fact that I did express last week when we had the discussion. When the College of Nurses make changes in regarding to the RN prescribing and the documents that RNAO will prepare, we will be behind. Because the College of Nurses, when they make change, they change their documents on the website, then people can access to their updated version. So either RNAO get to be always connected with the change of the College of Nurses, and they may mislead the people who are doing RN prescribing by not following what the College of Nurses will do and will change.
Hi, so honestly, I understand where that is coming from, but I don't think that is unique to RN prescribing resources. Any practice resource, toolkit, or anything that is a guidance document would naturally need to evolve as legislation, practice, evidence continues to change.
Thank you, Ruby. You have a question before we call for a vote?
Sure, I just had a quick question
Yeah.
for discussion. So what kind of implementation supports are you actually envisioning, Ruby?
Thank you. So I don't think implementation will look similar to every setting, as I mentioned. However, some practical examples could include sample policies, documentation templates, workflow examples, even shared lessons between organizations.
I think this is an operational question.
That's my kitchen.
Yeah.
Yes.
Yeah.
Exactly.
Yeah.
And she will be cooking with me.
Yes.
And maybe I even will bring Paul-André that had a different perspective, if it passes. But
Yeah.
that's my kitchen, I'm the cook.
Yeah.
That's the sous chef.
Yes, thank you. So moving on.
Call the question.
Seeing no one?
I would like to propose that we vote on the amendment.
Yes, sorry?
I would like to propose that we vote on the amendment.
Yes, thank you. So mover and the seconder, can we have
Elizabeth
a
Strauss Enrig, I so move.
Yes. And then can we have a seconder?
Rachel Woods, Chatham-Kent Chapter. I second this motion.
Thank you. And let's vote in favor. All in favor?
Yes, sorry, I thought I'm getting that.
Okay. Against? Against? Abstention? Okay. Resolution, no. The motion amended is passed. Elizabeth. Elizabeth, yeah. Okay, thank you. Now we are going to vote for the resolution as amended. Right. Let's vote. All in favor? Okay. Any against? Abstention? Okay. Resolution carried. Thank you. All right. Now we are going to move on to Resolution 6. Betty?
Resolution 6, to develop a comprehensive RNAO strategy to help nursing educational institutions adopt planetary health principles. Submitted by Rachel Gonzalez, Hugo Tam, Rob Samuelek, May Teo, and one executive team in collaboration with the Ontario Nurses for the Environment. Therefore, be it resolved that the Registered Nurses Association of Ontario develop a comprehensive strategy to support nursing educational institutions to adopt planetary health principles throughout Ontario. Therefore, be it further resolved that RNA collaborate with CASN, COUPN, and CAATS and other relevant partners to developing the comprehensive strategy.
Thank you. And we have a mover.
So I would like to move for an amendment to add CNO to the list, and I think there it is. So,
You have to move this first before you propose the amendment.
okay, I propose to move the first part.
Yes, I need a mover for the first.
I move it.
Okay, thank you. Can we have a seconder? Yep.
Sarah Thornley, Rainbow
Sarah.
Nursing Interest Group, I second.
Thank you.
And then I move for the amendment.
Okay, and you move the amendment too. Thank you. And then can we have a seconder for the amendment?
Sarah Thornley, Rainbow Nursing Interest Group, I second the amendment.
Okay, thank you. Now can we?
Okay, so I'm speaking in favor of this because climate change is here. We are having wildfire seasons in the summer. There was a kid named Carter Vay. He was 9 years old. He was a healthy soccer player in the morning, and he had died by nighttime because it was smoke. So asthma, COPD, respiratory illnesses with wildfire smoke. Wildfire smoke also affects clotting, increasing heart attacks, strokes, and more things and other things. There's also heat illness, and many other related topics around planetary health. And the next generation of nurses need to know this. So it has to start getting taught in nursing education so that it grows into the profession. So planetary health principles have to be taught in nursing school. And it needs to be added to competencies, which is why there's a list with all those letters in it. All these groups have competencies in them. And from there are schools that are already implementing planetary health into their curriculum. It doesn't have to be a standalone course to take away more time, which is the usual argument. It can be blended in with the curriculum throughout. So all existing courses, it can just be added throughout the.
Thank you, Rob. Thank you. Yeah.
Hi, Anita Purdy, Chatham-Kent chapter. I just wanted a little clarification. I did ask it when we had our meetings last week too. It doesn't really say that you want the education in the program. It talks about the educational organization adopting the principles. So that almost sounds like I want the universities to do more recycling or something. It wasn't clear for me. I support either of them. But definitely we need it in the education. I'm not sure that it's clear that it's saying that.
Okay, thank you. Hugo?
Just for a point of clarification, that is why the CNO was added into there. all university nursing programs are teaching according to the CNO entry to practice competencies, and I can't speak for the other nursing programs, as I do know that there are some programs that have included planetary health courses and units into their program, but for example mine, we don't touch on it at all. And we're not asking for, again, like a standalone course, but we're really looking for those principles to be embedded throughout the 4 years of the BSEM program, or even the 2.5-year accelerated program, just so that we're all aware of our own nursing practice and what healthcare contributes to the detriments of planetary health.
Thank you. Yeah. And
To answer that last question, we could put an amendment to adopt planetary health principles in curricula.
If I may,
Yes.
bring you to my kitchen, spaghetti included. You're right in what you said. However, if it's this way, you have everything. It doesn't exclude what you're saying. Maybe it allows that it's on education, it's on research, right, etc.
That's why the strategy is there, because it's broad, but if people want curricula, we could add it.
I guess we'll leave it in the kitchen.
Well, it doesn't change the intent, so you do what you want.
Okay. So, we are now going to call for vote. All in favor of the amended resolution? Okay. Thank you. Any against? Against? No. Abstention? Okay. Thank you. Amended resolution carried. Now, we'll wait for the big clap. We'll vote in favor, not in favor. We'll vote for the resolution as amended. All in favor? Okay. Thank you. Any against? Any abstention? Okay. No. Abstention? No. No.
Yeah, well, it's the case. So
Yeah. No. Thank you. The motion is, the resolution as amended is carried. Now let's clap. Thank you. We are now going to move on to resolution number 7, Betty.
Okay, Resolution 7, Preventing Discharge from Hospital to Homelessness, submitted by Brent Halaman Norfolk Chapter and Matthew McGuigan. Therefore, be it resolved that the Registered Nurses Association of Ontario advocate the provincial government to require hospitals to have a plan to prevent discharge to homelessness using evidence-based strategies such as having an on-site social supports that include housing and financial assistance. And therefore, be it further resolved that RNAO advocate the provincial government for hospital-based on-site social supports, including housing advocates, identification card clinics, financial support assistance, Ontario Works and Ontario Disability Support Programs, with wraparound transitional support provided in the community following discharge.
Thank you. Can we have a mover?
Akeem Edwards from Brant Haldeman Norfolk Chapter. I so move.
Thank you. Can we have a seconder?
Katie Josa, also Brant Haldeman Norfolk, and I so second.
Thank you. Discussion?
Akeem Edwards from Brant Haldeman Norfolk Chapter. I now defer to Patrick to speak on the resolution.
Thank you.
Thank you. Patrick McCaffrey, RN Brant Haldeman Norfolk. Vulnerable and minority populations disproportionately experience homelessness. In 2006, 194 individuals within London were discharged directly from psychiatric inpatient units to shelters. From 2022 to 2023, approximately 30,000 people were experiencing homelessness at hospital admission and or discharge. Utilizing an evidence-based model from hospital, the Preventing Discharge to No Fixed Address project has previously demonstrated the beneficial impact of hospital-based interventions. This resolution is paramount of social determinants of health, which have only exacerbated since the COVID-19 pandemic and interrelated mental health crisis. I strongly urge for this resolution to be voted forward and for discussion.
Thank you. Next one on the mic.
Irene Fang, Regional 7 Rep.
So I actually lived in Toronto community housing for many years. Even though I pay market rent, not subsidized rent, I interact with everybody. I'm the tenant rep elected for many years. So what I see is we don't have enough subsidized housing. The waiting list is on average 9 years. If you're just saying, let's shift all the housing units to all those who have been discharged from the hospital, it doesn't solve the problem. The people are still waiting. And sometimes it's the people who know how to work the system. They go into have a surgery on the elbow, kidney, something. They discharge, they get into subsidized housing, they recover fully, and they're in forever because housing has a policy. It's whoever in does not have to move out. So then those who actually have mental health issues, but they're not smart enough to work the system to get into the hospital as an inpatient, they actually, if you move all the units for all the hospital discharge, they're going to wait longer and longer and longer.
Thank you. Thank you. Mike 1.
Noah Reisman, South Simcoe chapter. I speak in favor of this motion. I work for a transitions hospital to home program, and with my lived experience, countless times have we had clients that return home if they're lucky to have one, and they are met with insufficient funds, they can't afford their medications, they are facing housing insecurity or other issues where they need to move quite quickly. And it, in my opinion, is not right for programs like ours or Ontario Health at Home to be stuck picking up the pieces when it should be things that are arranged prior to discharge from hospital.
Okay, thank you. Over you.
You can go ahead, Paul.
Yep.
Paul-Henri Gauthier, I speak in favor of these resolutions. I'm the clinical nurse specialist. One of the things we didn't mention, and I did suggest it last week, in collaboration with City Council, because in Northern Ontario, City Councils are involved also with people who are homeless in the street, and they have also the resource to help coordinate also with the hospital and healthcare services to avoid the default through the gaps and the cracks. Thank you.
Yeah, so I guess that's also an operational thing, so it's going to go in the...
That's why I didn't make a motion.
Thank you very much. So you know what needs to belong to the kitchen. Thank you. Okay, can we... Matthew, you want...
So as mentioned, this has been going on in London for, I think, 2+ decades now, where there's been a process to prevent people from being discharged into homelessness, whether it is to transitional housing units, shelters, or in some cases, long-term care, based off of the individual's needs. It is not going to be a one-size-fits-all solution, but it's better than not doing anything. So recognizing that there is limited housing stock and that it is something that is affecting everywhere in Ontario, it still is better to have something in place for those individuals who are ready, not necessarily who are trying to game the system, recognizing that during COVID, 60% of all new cases of homelessness were first time and were a result of various different circumstances. Not necessarily substance use, not necessarily not being unemployment, but a variety of complex situations. So it's doable. It requires significant coordination.
Thank you.
And it can't be ruled out entirely.
Thank you. Paula?
Paul Emanuel, South Simcoe chapter. I speak in favor of this resolution because there needs to be accountability across the board. Universality, comprehensiveness, everyone is entitled to get support. And the key thing is use creativity and imagination, because what can be considered traditional housing, it can be new housing. You get a motel room for somebody, you get Meals on Meals, and you support them that way. That's not operations, that's governance, and that's saying let's vote the question. Thank you.
Thank you, Paula. Seeing no one at the mic, I'm going to call the question. All in favor? Okay. Anyone against? Against? No? Any abstention? Okay. Resolution, we didn't amend any. Resolution passed. Motion passed. Paula. Sorry, Paula. Siobhan, I see that you've done a very genius thing of putting a timer on the screen. Thank you. You got to, yeah, that's a super good idea. But I want to ask that you press the timer as soon as the resolution comes on the display. Thank you. No, he knows it. He said yes. Thank you. Okay, amazing. All right. We are now going on to Resolution 8.
Resolution 8, RNAO to advocate to the Ministry of Education non-wage subsidies and clinical placements for undergraduate nursing students, submitted by
Gurkirat
Singh, thank you, and Thonio Chekowin on behalf of the Nursing Students of Ontario Interest Group, and I apologize again for the names. Therefore, be it resolved that the Registered Nurses Association of Ontario advocate to the Government of Ontario for the development and implementation of provincially funded and subsidized paid clinical placement models for undergraduate nursing students. Therefore, be it further resolved that RNAO collaborates with nursing schools, clinical placement partners, regulatory authorities, unions, and the government to provide standardized frameworks, suitable supervision systems, and long-term funding mechanisms that ensure safe and equitable care. For example, students undertaking their final practicum or consolidation placement should get remuneration in the form of alternate services such as free or subsidized parking, transportation supports, meal subsidies, and access to hospital amenities, including libraries, computers, and study places.
Okay, can we have a mover?
Matthew Mark, Nursing Students of Ontario, I so move.
Thank you. Can we have a seconder?
Allison Norton, Region 11 Sudbury Chapter, ISO second.
Thank you. Open up for discussion. Question?
Quick.
Yes, Hugo.
Amendments were sent in. Could I have the amendments? Yeah. I'll be speaking on behalf of Gurkara and Antonia.
So that's the amended motion right
Yeah.
up there. But
Okay.
we need someone, a consultative rep, to move that. We need a consultative rep to move the amended motion. Yeah.
Move the amendment. Paul Emmanuel, South Simcoe.
Thank you. Can we have a seconder?
Akeem Edwards, North Brantford, Haldeman, I second.
Okay, thank you.
Okay, so I realized there was a bit of clarification that was needed in the therefore be it resolved. So I just want to start with clinical placements or practicums are an essential component of undergraduate nursing programs, but it does place a significant financial strain on its nursing students, juggling from part-time to full-time clinical practicum hours in their final semester, while also working part-time. Employment creates undue stress and unequal opportunities for success. And although paid clinical practicums have been a topic of discussion for many years, its implementation has been at a standstill primarily due to budgetary constraints and bureaucratic barriers. To alleviate financial barriers, non-wage subsidies are a practical and effective strategy to lower the cost of attending clinical practicums as we continue to see the cost of living continue to rise, and which in turn also disproportionately affects nursing students from underserved and minorities. Thus, non-wage subsidies can cover mileage, parking, and meals, which can strengthen Ontario's incoming nursing workforce, whilst making nursing practicums more equitable and improving the quality and sustainability of patient care.
Thank you. Seeing none at the mic, can we call a vote? All in favor? Okay, thank you. Any abstention? Okay. Anyone against? No? Against? Oh, yes. Okay. So the amended motion is carried. Now we are going to move on. No, Andre, fast. We are going to now vote for the resolution.
It's the wrong ministry, madam. It's not the Ministry of Education, it's Ministry of College and University.
Now, we are going to vote for the resolution as amended, the original resolution. So all in favor? Thank you. Any abstention? Do we need to call it? Any against? No? Thank you. Motion is carried as amended. Resolution. Okay. Now, Resolution 9.
Resolution 9, wounds as a public health priority, submitted by Matthew McGuigan and Rosemary Carr. Therefore, be it resolved that the Registered Nurses Association of Ontario use its leadership and policy influence to collaborate with relevant partners and the Government of Ontario to coordinate the launch of a virtual wound care center of excellence, recognizing wound care as a universal right.
Thank you. Can we have a mover? Mover? Yeah.
Allison Norton, Regional 11 Sudbury Chapter. I so move.
Thank you. Can we have a seconder?
Paula Eisted, Seaway Chapter, I second.
Okay, thank you.
See, they put us vocal people way in the back so we can't get up here.
Okay. Open for discussion, yeah?
Yeah, so this resolution came about after some colleagues and I put together a project to provide training to over 50 community members within Chatham-Kent, made up of people with lived experience of substance use and homelessness, volunteers, and healthcare professionals to provide comprehensive wound care training to support those who are unhoused in our community. During this process, I recognized that public health, as a public health nurse, could play a potentially important role within advancing wound education, interventions, and just sort of more upstream approaches to wounds to prevent the occurrence of chronic wounds. Recognizing that there's still a bit of work that needs to be done on this resolution, I am going to be withdrawing it from the AGM. Thank you.
Good. Yeah. So, I guess we're good. Can we call for? I see no one on the mic. So we're going to call the question. All in favor? We are voting now because there's no one at the mic. So all in favor of the resolution? Hey? Oh, he withdrew it. Okay, thank you. The vote's dead. I think I'm too caffeinated right now. Okay, so let's go on to resolution number 10.
Resolution 10, advocate and partner for nursing leadership development across healthcare organizations. Oops, sorry. Submitted by Sue Bookie Bassett, Heather Thompson, on behalf of the NLN of Ontario Nurses Interest Group. Therefore, be it resolved that the Registered Nurses Association of Ontario, in collaboration with the Nursing Leadership Network of Ontario, explore opportunities to partner with academic institutions, the Canadian Association for Schools of Nursing, and the Canadian Nurses Association to enforce sustainable nursing leadership development programs.
Okay.
Elizabeth Strauss-Enrig, I so move.
Thank you.
And I second.
Angela Cooper, Brathwaite, Durham Chapter, I so second.
Thank you.
And I cede my time to the resolution submitter.
Okay.
Thank you very much. Sue Bookie Bassett, Nursing Leadership Interest Group, Nursing Leadership Interest Group. This resolution is really about ensuring the development of strong nursing leadership across all health sectors in Ontario and across all nursing leadership levels. We know from RNAO reports, evidence from research, as well as experiences as an academic professor, that leadership in nursing is critical to the workforce in terms of safety, safety for patients, but also continuing development of the workforce. In the last number of years since COVID, we know that many people who were in leadership roles have moved on or retired in their careers, and newer nurses with less experience are being moved into leadership roles with inadequate or less preparation than is needed. And we really believe strongly that the leadership development needs to be done in collaboration across all the organizations that you see in terms of the statement on the screen. So leadership development can't be developed in isolation. It needs to be developed in collaboration with academic partners, practice partners, building on the competencies that are required both at the level of CASN and CNO in order to develop competencies and leadership skills at a basic level, but then also for professional development purposes. For example, for those who are new in nursing manager roles, how do they continue to develop their own skills as a nursing leader? We hear from our members of NLN, they want more development in terms of leadership programs and resources, and so I bring to this meeting and open it for discussion in terms of ongoing support for nursing leadership in Ontario.
Thank you. Dr. Doris?
Siobhan, can I ask that you put the stop on the clock so I don't steal time? I do think it's important, and I want Subuki Bassett, Dr. Subuki Bassett, a clarification. And I also want to thank the colleague that before spoke in another resolution, somewhere there, it's difficult to see with this, about clinical leadership. So when you're saying leadership, are you referring to leadership in all roles? Or are you referring to executive leadership or to managerial leadership? What are you referring?
Ideally across all levels, because we know there's gaps in terms of the practice level, so frontline managerial levels, so but also CNE levels.
Also, exactly, CNS is another. The reason I'm asking is because that is completely consistent with RNO's BPG on development and sustainability of leadership, and I'm glad you clarify, because you all should take this back home. Why I am saying is many times in conferences, people refer to leadership. You guys, everybody, leadership, and they're referring only to executive or administrative leadership, meaning formal leadership roles. CNSs are formal leadership role, clinical practice. NPs are formal leadership role. You know, any other staff nurses, they're fantastic at wound care or at whatever. You're right in their leadership role. Please take it away with you, what she said, leadership in all roles at all levels. Thank you, Sue.
Yeah, we can start the time again. Okay? Yes. I think it was Mike 3.
Ngozi Nwachukwu from Brampton chapter. I'm supporting this resolution, and I'm proud to say that my organization, Trillium Health Partners, has some programs like this, leadership programs that develop staff across all levels, and I'm a recipient of one of those. Thank you.
Yes, mic number 4.
Mike Mercer, Ontario Correctional Nurses Interest Group. I'm speaking in favor of this resolution as someone who went from being a staff nurse to a nurse leader within 24 hours and was offered no mentorship, no guidance, basically a sink or swim attitude. I feel that's unfair to both the leader and to those that you're leading. And I watch this still happen. So I really think that this is an important resolution that we carry forward.
Thank you. I guess mic 4.
I stand in full support of this. It is so very important, and for all the nurses who are here, when you're asked after a few weeks, months or so to be a leader in any unit, then you'll understand why it's so very important. Please think about this very seriously.
Thank you. Mic 2.
Katie from Brant Haldeman, Norfolk. I support this. I previously, not anymore, but I was an NRT nurse, and during one of my shifts, it was one of my first shifts on a new unit. I was the only RN on the unit. I had 13 patients, and I was put into a charge nurse role where I was a new graduate and had no idea what I was doing. So I support this.
Thank you. Mic 1.
Noah Reisman, South Simcoe chapter. Similarly to the person before me, when I first graduated from nursing school, my very first job, I was put as the charge nurse of an acute psychiatric unit. I had no idea what I was doing, and I would have appreciated formal leadership training prior to and during that experience. That role only lasted 8 months for me because I knew that I wasn't right for that position. Thank you.
Thank you. See, no, Paula?
Just one final point. I think it's important to have nurses in positions of leadership, and the strength and diversity of having not 100% nurses, but certainly enough that it will influence the practice realms of RNs and RPNs. That is really key. And I thank Sue Bookie-Bassett, who has listed leadership as one of her go-tos for 30 years. She was 10 at the time. But I thank you for that. Thank you.
Thank you, Paula. I'm going to call the question. All in favor? Okay. Thank you. Any opposed? No. Abstention? No. Motion's carried. Thank you.
Given that there is like 47 seconds, Dr. Subiki Bassett, you should share that an article was just published on the leadership program, mentorship and leadership of RNO that you were part of, Janet Chi and you and others. Share where, though? I don't need to
share where? Oh, it's
where it was published.
Where it was published, Journal of Nursing Education and Practice. So it's in on the back of the resolution. There's a reference list for a few studies that have been done locally in Ontario. Am I allowed to say one more thing? 14 seconds. The only other thing I was going to add just to support the resolution further is that from the research during COVID, we know that different leadership styles are needed and different competencies are needed. And so that's why we're behind this resolution as well.
Thank you. It passed. Resolution number 11. Betty?
All right. Resolution 11, supporting mandated comprehensive palliative care education in Ontario nursing schools. Submitted by Christina Bolico, Anna Constantine, and the following nursing students: Carly Wong, Nevin Shanoa, Katie Brown, Cassie Wilson, and Eileen Getruk. Therefore, be it resolved that the Registered Nurses Association of Ontario advocate to the provincial government, regulatory nursing bodies, and other educational partners for the development of a standardized, mandatory, competency-based palliative care nursing curriculum.
Okay, thank you. Can we have a mover?
Selena Carter, Palliative Care Nurses Interest Group. I move to vote on the proposed amended resolution. Can I do that?
No.
Okay, then I so move.
Noah Reisman, South Simcoe chapter. I so second.
Okay, thank you.
Selena Carter, Palliative Care Nurses Interest Group. I move to vote on the proposed amended resolution.
Okay, so the amended resolution is up on the board.
And I defer to the submitter.
Yeah, so you moved the amended, and then we need to have a seconder for the amended.
Come back. Anybody at all?
Seconder,
Noah Reisman, South Simcoe chapter. I so second.
the amended motion. Yes? Okay, discussion.
Thank you so much. Good afternoon, consultation representatives and member of the board. My name is Christina, and I am the resolution submitter. No matter where nurses work, in acute care, long-term care, community, or hospice, we will care for people experiencing serious illness, grief, suffering, and loss. Yet many nursing students graduate without a comprehensive understanding of palliative care. As a new graduate nurse working in palliative care and an executive member of the Palliative Interest Group, I have seen how essential these skills are, not only for providing quality patient care, but for supporting nurses themselves. Palliative care is often misunderstood as only end-of-life care. In reality, it is a holistic, person-centered approach that improves quality of life for individuals facing life-changing and life-limiting illness through symptom management, emotional support, communication, relationships, and compassionate care. These are not niche skills limited to hospice settings. They are foundational nursing skills relevant to across nearly every specialty and practice settings. Despite the importance of palliative care, Ontario currently lacks clear guidance outlining what comprehensive palliative care nursing education should include. While palliative care appears in CASN accreditation standards and CNO entry to practice competencies, expectations remain vague and inconsistent across institutions. Leaving this education to individual schools does not ensure that future nurses are adequately prepared to provide safe, compassionate, and person-centered palliative care. Furthermore, poor preparation for the realities of grief and loss contribute to new graduate burnout and poor retention. Ontario already has strong competency frameworks, best practice guidelines from the RNAO, and these can be integrated into existing curricula through lectures, simulations, mentorship, and placement opportunities. By supporting this resolution, RNAO can advocate for stronger and more consistent preparation for future nurses, preparation that improves patient care, supports nurse well-being, and strengthens our healthcare system. So I urge you to vote in favor of the resolution. Thank you.
Thank you. Paul-Andre?
Paul-Andre Gauthier, Clinical Nurse Specialist Association of Ontario. I'm in support of the amended motion because I'm a specialist in palliative care. I have 2 clinical masters, and yes, it is needed. However, I will also give a word of caution. With all the elements we want to add to curriculum, 4 years won't be enough pretty soon. We'll have to have a 5th year. Just a word of caution.
Thank you.
This is a moment of history. Can you put the alarm clock? It's not an alarm clock. I don't need that. Paul-Andre, you remind me, Paul-Andre, you remind me, you're right on what you said, because I'm looking at them and I need to go to Coupon and Cats, nobody else. And you will come with me because to each one of you. But it reminds me, and I'm sure at least 1 or 2 people were here, in one of my first AGMs. First of all, I was from 92 to 94 in the board, so it might be there. But no, I was sitting here, not as a board, as the new executive director. And someone very courageous wanted to put something about gerontology for the schools. And I'm not going to remind people who, because you still may know the person, out there was the chair of CATS or Coupon, stands up and says this has nothing to do with RNO. RNO doesn't have a right to talk about curriculum. Well, we moved all the pendulum to RNO has everything to do with the curriculum. Yeah. Good for you guys.
Thank you. We are now going to, you have a question? Paula?
No, I was just going to speak in favor of the resolution because nurses graduate with a lot of skills and knowledge that are not perhaps well versed in, but they still have to learn about it. And I remember graduating 45 years ago. I was 5 at the time. And the key thing was I knew I was going to have patients that died and be palliative. And I learned it on my own as well. Because there's tools and resources around, even 40 odd years ago. So I think it's a joint effort. It's not just all the academics. It would have to be an everyday practice as well. Thank you.
Thank you. Now I'm going to call the question. Yes, I remember. All in favor of the amendment? Okay. Any opposed? 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 No. Abstention? No. Amended motion is carried. Now, we are going to vote on the resolution as amended. All in favor? Okay. Thank you. Opposed? Abstention? None. Oh, abstention? I see. Yeah, few. But the resolution is carried as amended. Okay, we are now resolution 12. Betty?
All right.
We just have 5 more to go.
Resolution 12, continuing advocacy and efforts to address growing rates of intimate partner violence, submitted by Emma, Arthur, Maria Tando, Sandrina N. So awful. Salisa and Upneat Arans on behalf of Brampton and Mississauga chapters. Therefore, be it resolved that the Registered Nurses Association of Ontario advocate to municipal provincial and federal governments for increased funding in order to promote public awareness and education about IPV, improve access to support services, for example, safe and non-judgmental spaces where victims can go for help, legal support, and crisis lines, expand affordable long-term housing and accessible infrastructure for individuals facing IPV, for example, emergency shelters.
Okay, thank you. Can we have a mover?
Ngozi Nwachukwu, Brampton Chapter, I so move.
Thank you. Can we have a seconder?
Rachel Woods, Chatham-Kent Chapter, I second.
Thank you. Open up for discussion. Philasi?
Yes, I just want to share that we do have an amendment that was sent. Thank you.
So, are you moving?
Oh, okay, if I can, yes, I will move.
Oh, it has to be a consultative
Yeah.
rep. So the consultative rep has to,
She is a consultation.
but she's what, the submitter, no?
She is also a submitter. I
She's a consultant,
will
so she-
move the motion for the proposed amendment.
Thank you. And the seconder, Paula?
Paula Manuel, South Simcoe, I second the motion.
Okay, thank you.
Okay, thank you so much. So first of all, I want to express my gratitude to Dr. Doris Grisbin and Home Office for all their efforts in this area. We are also grateful to all who offered advice to us during the sessions last week. RNO's current BPG has been instrumental in equipping nurses on how to conduct assessments, and there is an updated BPG version coming on. And we are happy to see RNO's continued efforts to advocate. And the fruit was recently shown in a landmark decision from the Supreme Court of Canada, which allows survivors to pursue damages against their intimate partners, including because of different forms of abuse, such as financial control, isolation, intimidation, and not excluding physical violence. Allow me to share the story of a nurse. She has been working for many years. She has a partner and children. They go on vacations. On a professional and personal level, she is an excellent worker and a good friend. She did not mention anything to you, but she's been off work for a bit. You think to yourself, she'll be back. Now follow me as I bring you to the other side of the story. Your colleague and friend just left her partner due to intimate partner violence, and she goes to a shelter and is told there is no room. What does she do? Should she go back? What about the children? Where should she go? This is not the story of one person. This is the story of many individuals. So I ask that you support this resolution moving forward. There are many barriers that we have to overcome. There are gaps in legal protection and in raising public awareness, emphasizing the need for more policy reforms, expanded funding, physical infrastructures. Thank you.
Thank you. Una?
I totally support this resolution. I had the unfortunate thing to work with a nurse who came into work one morning, literally pulped, like she was beaten to a pulp. She came into work because she had no place to go. And we ended up having to send her out to emerge because she was so badly beaten. We didn't know what was going to happen next. She did eventually return to work, but once you see it, you'll never forget it.
Kathy, you have a question?
Kathy Moreland, Windsor, Essex. We certainly support this resolution wholeheartedly in collaboration. We also want to make sure that it's noted that currently there's Bill 189 in the Ontario legislature asking our government to declare intimate partner violence an epidemic in this province, and it has been tabled 3 times. So I would just ask that we support this resolution as part of that, and so we fully support it. I think we should just go.
Thank you. Thank you. Seeing no more at the mic, I'm going to call the question. All in favor? Okay. Thank you. Any opposed? Amended motion carried. Yeah. And now I'm going to call the question for the resolution as amended. All in favor? Thank you. Anyone against? No abstention? Resolution carried as amended. Dr. Doris would just like to...
For a second, and thank you, Selassie, where is Selassie? Here, for acknowledging the work of Areneo. When I was at Sinai, so we go back before the 30 years. And all of these situations are very public once the person is killed, unfortunately. I will never, ever forget Dr. Andrea Baumann and the phone call that the students alerted her that the prof didn't come, and that's how they said, right, the prof didn't come. She always showed up, and Andrea needed to go. They had no idea, no idea. They knew nothing. And I don't want to describe to you what she saw, and I do hope that the person that murdered her is still rotting in jail. A physician. We had another one in London. Windsor, thank you, Windsor. We had another one in Toronto, public health, 2 children. And that was related to a shelter. It was not that there was no space in the shelter that day, but the shelter cannot keep people forever because they have, So they said she needed to leave. Meitao, you know where I'm talking, and also was public, so it's nothing secret. And we were in the flooded nose also. And she said, I can't go home. I don't have money, because also was the issue that you're talking was not only physical, was financial, was everything. So this is why the third case that we won, and Areneo was the only of 17 challengers that went to the Supreme Court, and the case was won. So now it's not only now physical, it's also psychological, it's also financial, it's also social isolation, you mentioned that, etc., etc. It's a huge win for women. You also need to know that we were challenged, we are Areneo, when in court, when we issued the second edition. The first was in 2005, second was 2012, by a gentleman, young gentleman, that said we were discriminating against men. So we took it very seriously, because there is also situations with men, but we fought it on the basis that women are the majority that suffers intimate partner, and we won. It's a very serious issue, and women, for the most, are ashamed of speaking about that, are ashamed that the community may know. It's a whole variety of issues. I think we should call this resolution, or we should work on it. And maybe it's the next VPG that will be out in 2027. And are you involved on that? Okay, you should be, at least as a reviewer. We are already well on our way, but any one of you that is meaningful for you and important and want to be involved, send me an email, because you should be at the very least a reviewer. 2027 will be out, so you will get it way before that, and we should dedicate it to all the nurses and other women, and maybe even put their names, because the names have been public.
Thank you. Thank you. We move on to resolution number 13. Betty?
Resolution 13, strengthening Indigenous partnerships to expand rural nursing practicums and to support the decolonization of Ontario nursing pedagogy. Submitted by Hugo Tam, Sierra Panchard, Esser Mamami, Lee Zhang, Simran Burke, and on the behalf of the nursing students of Ontario Interest Group. Therefore, be it resolved that the Registered Nurses Association of Ontario advocate and supports COUPN, CAATS, Ministry of Education, and participating Indigenous communities in ethical, reciprocal, and community-informed partnerships to expand clinical practicum opportunities for experimental learning to support social justice and in support of truth and reconciliation.
Thank you. Can we have a mover?
Matthew Mark, Nursing Students of Ontario, I so move.
Thank you. Can we have a seconder?
Excuse me.
Allison Norton, Region 11, Sudbury Chapter, I so second.
Thank you. Open for discussion.
Just to clarify, there is amendments were submitted, so could I get this amendments?
No, we need a consultative rep to move the motion for the amended. The amended one is up?
Nope.
Oh.
Selena Carter, Palliative Care Nurses Interest Group. I move to vote on the proposed amended resolution.
Thank you. And can we have a seconder for the amended motion?
Paula.
Paula?
A second the amendment, please.
Thank you, Paula. Okay. Now we can speak.
Okay, so speaking to this resolution, as nursing students and upcoming healthcare professionals, we do have an obligation as advocates and leaders to be able to provide culturally sensitive care. TRCC has 94 calls to action, with calls number 18 to 24, affirming the need for culturally sensitive, trauma-informed health education, to implement measurable metrics to quantify progress, and for the recognition of Indigenous health practices, and calls for Canadian institutions. To improve nursing students' uptake and retention of Indigenous ways of knowing, being, and doing, anti-Indigenous racism, Indigenous values in health and care, and their healing practices, we should challenge the status quo and limitations through experiential and contextual learning.
Thank you. Do we have?
Hi, I'm Matthew Mark, the consultation rep for the Nursing Students of Ontario, as well as chair-elect of the NSO. I'm speaking in support of this resolution. As nursing students, we are often taught the importance of cultural safety, anti-racism, and Indigenous ways of knowing within our curriculum. However, we lack this in the form of experiential opportunities, leaving this all to just talk. I will enter my 4th year at the University of Ottawa in September, and despite being in the capital of Canada, my colleagues and I at the University of Ottawa, as well as Algonquin College, funny enough, being named Algonquin, are taught very minimal content about Indigenous ways of knowing in our curriculums, but particularly in our clinical settings. Expanding Indigenous-focused rural practicums would strengthen nursing education, improve cultural humility, and help prepare future nurses to provide more informed, equitable, and holistic care for Indigenous peoples across Ontario and align with TRC's calls for action. Therefore, I highly encourage everyone to vote in favor of this resolution. Thank you.
Okay, so there's a point of order. Matthew, you moved the first motion? Yeah. You are a student still, right? You are a consultative rep?
Yeah, he's a CR for us.
NSO gets 1 consultation rep.
Okay, so consultation rep, yeah.
He's our CR.
Well spoken. I'm like ducking all the rays of fire that's coming around. All right, so we are all good. So can we call the question? All in favor of the amended resolution? Motion. Okay, thank you. Any opposed? No? Any abstention? Okay. Amended motion carried. Thank you. Now, we are going to call the question for the resolution as amended. All in favor? For? So you got to be here. Get a chair here.
The clinical nurse specialist. Madam President, when I was working in Timmins as a professor, at our School of Nursing, we had students going to Moose City Moose Factory for 2 months at a time. considering these elements, it's very expensive to go in reserve in area that are outside of the main centers, and they have to be in negotiation with the local authorities and to make sure that they can host the student, because one of the things we're finding is some places they cannot receive the student. So we have to be careful.
Okay, so Paul Andre, this is operational question, or are you speaking in favor?
Caution is still there.
Yes, okay. All right. This is all kitchen. So let me call the question. He interrupted in the middle. So all in favor of the resolution as amended? Thank you. Any opposed? Any abstention? Thank you. Resolution carried forward as amended. Okay, you guys are really making me work on my last day as the president. That's for sure.
You can
Resolution number 14, sickle cell resolution.
All right, Resolution 14, sickle cell resolution, submitted by Kewana Malcolm on behalf of the Black Nurses Leading Change Interest Group. Therefore, be it resolved that the Registered Nurses Association of Ontario adopt and publicly affirm a position statement in support of Bill S-201, an act respecting a national framework of sickle cell disease, recognizing sickle cell disease as a significant health issue in Canada, and affirming the need for coordinated national leadership to improve consistency, equity, and quality of care for people living with SCD.
Point of order. Can we pause the timer for a second?
I'm sorry?
Pause the timer for a second.
Yes.
This is a really, really, really long resolution. If we were to have any debate on it, which for any reason, can we have the timer paused to read the whole resolution first? Because it is quite long. And then restart the timer? Just so that the vote doesn't...
Yeah, sure. It'll be another minute. Yeah, so we'll, instead of the 7, we'll stop at 8. Yeah. Yeah. Okay.
Want me to read it?
So let's begin the clock.
Is that okay? Yes?
Yeah. So I guess the resolution, we had suggested already that it was long, right? And so I guess it's going to take time. So we just continue. Sorry, go on.
No, that's okay. I could have had it read by now. Just saying.
I know.
Therefore, be it further resolved that the RNAO undertakes sustained advocacy to advance a coordinated, equitable national approach to sickle cell disease care in Canada, including by advocating to local members of Parliament to support the passage of Bill S-201 in the House of Commons to improve coordination, equity, and quality of care for people living with SCD, advocating for the implementation of Bill S-201 framework to reduce preventable complications associated with SCD, improve patient and family experiences, and address health disparities affecting communities disproportionately impacted by the disease, supporting and promoting evidence-informed education and clinical practice guidelines on sickle cell disease for nurses across the continuum of care, consistent with RNAO's role in professional practice, leadership, and health system advocacy, advocating for enhanced and culturally responsive blood donation strategies to ensure a diverse, sustainable blood supply, recognizing that individuals living with SCD require ethnically matched blood donors in collaboration with the Ontario Ministry of Health and all relevant healthcare system partners.
Okay. Now can I call for a mover?
Allison Norton, Region 11, Sudbury Chapter. I so move.
Thank you.
Sandra Kendrick, Region 10. I so second.
Thank you, Sandra. Okay, discussion.
We have an amended resolution. I'd like to move that, please.
Yes.
Allison Norton, Region 11, Sudbury Chapter. Okay. I would like to move the amended motion.
Thank you, Allison.
And Sandra Kendrick, Region 10. I so second.
Second the amended motion. Okay, now you can speak.
So during the consultation rep session, it was recommended that it either be divided into 2 separate resolutions, and Dr. Greenspan was to check with the parliamentarian Another recommendation was to remove the therefore it be further resolved and make that be the resolution in its entirety. So I will be going with that.
Okay, thank you. Can we, yeah?
I can wait.
No, it's your turn.
I just wanted to speak in support of this resolution. I want to thank the submitter for bringing it forward. It's critically important, and I've heard stories about the inequity that people with sickle cell disease are facing, the bias that they're experiencing, and the fear that they have to seek care within the medical system. So I support this resolution.
Thank you.
Hi, my name is Amma from Brampton. I support this resolution because as a nurse, work with a few sickle cell disease patients that we don't know what to do with them. That's my unit. One of the reasons why I support sickle cell disease and I want this to pass because it's a deadly disease that affects many individuals and family. Supporting resolution can help increase awareness, improve access of treatment and care, encourage more research, and save people living sickle cell diseases, which faces discrimination and also complication diseases. Thank you.
Mike 4.
Yes, I am here to support this resolution as a member of the Black community who it affects a lot, and as a manager, as a nurse, as everybody going through the nursing profession, I have seen where there are opportunities and gaps.
Thank you. Mike 2.
Hi, my name is Dottie Nicholas, consultation rep for Region 7. I'm a registered nurse that worked at the Centenary Hospital from 1989 to 2020, and my only job was a clinical nurse specialist for sickle cell disease. I nursed them at the bedside, I nursed them in the clinic, coming to clinic as a clinic nurse. I founded the first sickle cell community hospital clinic at the Centenary Hospital, and I supported this bill 110%. When we advocated for newborn screening in Ontario in 2005, we projected to the legislature that we will only have about 25 babies born in Ontario with sickle cell disease. It is now 85 babies and 250 carriers, and the carriers are not reported. So 20 years from now, this is what we saw with so many babies born with sickle cell disease, and this is a bill that I also sat on in Ottawa, sorry about that, I missed my train of thought, and I think I supported this bill because it is necessary. Many babies that I nursed from babies, when they got to adult age, they died. I can count them on my fingers because the care is not consistent. So please, I supported this bill.
Thank you. Mike 2, would you want to say something? Oh, Mike 4.
Angela Cooper, Brathwaite, Durham Region, and I've cared for people with sickle cell disease in the Caribbean. And recently I've heard that some nurses are not giving them the appropriate treatment, and they're giving them something else for the pain, and having these people suffer so much because this is a very painful disease. And they were not given the appropriate treatment, but something just like they might just give some distilled water.
Okay.
But this is, people need to be educated about this and the impact it has on people.
Thank you, Angela. Mike 2.
Catherine Johnson, Durham Region Consultation Rep. I support this as a carrier. My child is a carrier. My brother died from this, and I've had the opportunity of working in both community hospitals where there was nothing in place and people were treated as drug seekers and left in pain, and advocacy did not work. But I've also had the opportunity to work at organizations where there are policies in place with medical directives where I can do the labs and I can give them good pain medication. And the difference it's astounding. So this continuity, I support this.
Thank you. Okay, now I'm going to call the question. All in favor of the amended resolution? Yes? Okay. Thank you. Any opposed? No. Any abstention? No. Motion is carried. The amended. Now, you have to, it's an exercise, yeah? Now we have to vote vote for the resolution as amended. All in favor? Okay, thank you. Opposed? Opposed? No. Abstain? No. Resolution carried as amended. Okay, so now, Betty, resolution number 15.
Resolution 15, expanding eligibility criteria for the Supervised Practice Experience Partnership, SPEP, program for the Internationally Educated Nurses, IENs, submitted by Mark Anthony Gravoso. Therefore, be it resolved that the Registered Nurses Association of Ontario call on the Ontario Ministry of Health and the College of Nurses of Ontario to expand eligibility for the Supervised Practice Experience Partnership program to include internationally educated nurses who have been out of nursing practice for more than 5 years, but no more than 8 years, and established a standardized minimum of 240 hours of supervised practice across Ontario.
Thank you. Can we have a mover?
Ian Alagadan from Durham. I so move.
Okay. Can we have a seconder?
Uche Fire from South Cinco. I second.
Thank you. Open for discussion. Do we have the submitter here? Is Mark here? Do you want to say something? Or is there anyone else? Go ahead, Mark.
Okay. IENs represent a significant and growing source of skilled nursing professionals who can help address the ongoing nursing workforce shortages across Ontario. The ASPEP program is an important collaborative initiative between the CNO, Ontario Health, and CNO-approved organizations. This initiative has already proven to be an effective pathway for many international educated nurses seeking registration in Ontario because it balances public safety with fair access to licensure opportunities. Through structured supervision and competency-based assessment, applicants are evaluated in real clinical settings to ensure that they are prepared to practice safely and competently. IEN applicants may qualify for ASPEP if they have met all the registration requirements except for evidence of practice. However, under the current eligibility criteria, applicants must not have been out of nursing practice for more than 5 years before applying to the program. This current 5-year cutoff unintentionally excludes many skilled, experienced, capable nurses from participating in the program due to systemic barriers beyond their control. So many IEN who possess years of invaluable clinical experience who have been already met most of the nursing registration requirements are prevented from accessing the ASPEP program solely because they exceed the current 5-year cutoff. As a result, some IENs choose to return to their country of origin to obtain recent evidence of practice to meet Ontario licensure requirements. However, this approach may raise concerns regarding patient safety and readiness for re-entry into the Canadian healthcare system. Under this proposal, IENs who have met all the registration requirements except for evidence of practice and who have been out of practice no more than 8 years would automatically qualify for the ASPEC program, similarly to the current eligibility granted to nurses registered in a non-practicing class who have been away from practice from 3 but no more than 8 years for reinstatement in the general class. In addition, applicants who may complete the standardized minimum of 240 hours supervised practice as recommended in the research study conducted by Eaton and Henderson published in the Journal of Nursing Regulation.
Mark. Thank you. That was super fast. You got a lot of content there. Mike one.
Paul-André Gauthier, clinical nurse specialist. I speak against this resolution. Nurses who are educated here in Ontario have a maximum of 3 years without being into nursing. And people who are from other countries who are coming to Canada may have some challenge about the Canadian standards and the way we do care. So we should not, for safety reason, ask something different from somebody who has not been into nursing even here for more than 3 years. So I speak against this resolution.
Thank you. Mike 4 first and then Mike 3.
Angela Cooper Brathwaite, I support this resolution. I am an internationally educated nurse, and one of the problems with when nurses come to Canada, depending on which province you enter this country into to practice, you are delayed in getting registered to practice. And the longer you stay to get registered, you're wasting time. And therefore, these nurses' knowledge, they're not practicing. Of course, if you're not practicing, how are you going to maintain those skills? So I support, strongly support this resolution.
Thank you.
Thank you.
Mike 3.
I'm also in favor of this resolution because a number of people who are coming from internationally educated locales are also coming from places that have climate change issues and war and strife. I had a colleague who came from Africa who went to Italy and then to Germany and then to Canada, and she finally was able to get her designation of RN in Canada here, but it took her 7 years. And that's 7 years that she was very patient and diligent. So I put that as a small anecdote, but it speaks to thousands of individuals.
Thank you. Mike 4.
Thank you. Ramesh from Region 7. I'm one of the internationally educated nurses who came to this country. It took 3 years for me to get the registration done. Reason being, I need to get all the educational documents from my own home country, get it to the credentialing assessment agency. It takes time. By the time you are ready, meeting the educational requirements, it takes 3 years, and then you have to meet the registration requirements. That takes time. 8 years appears to be a long period of time, but it doesn't mean that everyone is going to who's having 8 years of gap is going to be allowed to practice. I understand the concern raised by Paul Andre, but remember, Paul Andre, 240 hours is enough for them to come back to practice. People are coming with 10 years of experience, 20 years of experience, and then we are wasting those experienced nurses' skills to be utilized. Like we are short of nurses. We need nurses, right? And I support this resolution. And thank you.
Thank you, Ramesh.
Thank you. And people, they just don't become automatically, registered, right? They need to go through the process. They are evaluated by preceptors. Then only they are allowed to come in.
Thank you. I guess, Chandra, now you have only 20 seconds.
With all due respect to Andre's concern, as an educator manager, but also speaking as my lived experience as an IM. So it took me 5 years. So we are not saying that doing that 240 hours of supervised practice, we're just giving you.
We need to call a vote now, okay?
Yeah.
Let's call for the vote. All in favor? Okay, thank you. Against? Opposed? Okay. Abstain? Okay. Motion is carried.
Thank you. Thank you so much.
Okay, now I have a new partner.
We're
Sue.
adaptable. All right, Resolution 16 is to advocate to Council of Ontario University Programs in Nursing, CUPN, and College of Applied Arts and Technology, CATS, for the standardization of clinical practicum opportunities to meet the College of Nurses of Ontario's entry to practice competencies. This was submitted by Simran Virk, Gurpreet Singh, Hugo Tam, Sierra Punchard, and their students on behalf of the Nursing Students of Ontario. Therefore, be it resolved that the Registered Nurses Association of Ontario advocate to the Council of Ontario University Programs in Nursing and College of Applied Arts and Technologies for the standardization of province-wide clinical practicum opportunities that include but are not limited to defined minimum learning objectives and competency expectations for the clinical placements designated under the same specialty or course title, regardless of care setting. Therefore, be it further resolved, in the case that the above needs are not met, the nursing program should provide, to a reasonable extent, supplemental simulation or practical experience to meet competency gaps.
Thank you, Sue. Can we have a mover?
Wanted to say that there should be amendments to it as well.
No, first we move.
Okay.
Okay.
Matthew Mark, Nursing Students of Ontario, I so move.
Yeah, I'm getting a little expert now. We move. Okay, can we have a seconder?
Hi. Valerie Noel, Region 7, Toronto East.
Thank you. Okay, now you can move the amendment. A consultative rep to move the amended resolution. Who is going to move the amendment?
Tick. Paula Southfield, I will so move.
Okay, Paula, yes, thank you. Can we have a
Selena
seconder?
Carter, Palliative Care Nurses Interest Group. I second.
Thank you. The amended motion, thank you. And now we can have the discussion.
So clinical practicums are a critical component of undergraduate nursing programs and are foundational in preparing students to transition safely into professional practice whilst providing safe and competent care. However, clinical practicums widely vary depending on setting, availability of opportunities, and organizational support structures, or lack thereof, resulting in fewer opportunities to develop adequate clinical judgment that may not meet the CNO's entry to practice competencies. Such may include basic skills like appropriate and safe medication preparation and administration, insertion of and management of LDAs, and the ability to recognize and manage patient deterioration. Despite varying clinical settings, students are assessed using uniform evaluation tools, leading to graduates with varying levels of preparedness but with the same designation, thus masking systemic shortcomings. Such masking may lead to transition shock, lower confidence levels, and poor retention rates among new graduate nurses, which implicate poorly for nurses and patient care. Standardization of clinical practicum opportunities will help promote transparency, accountability, and equitable nursing practice, and education, thus helping produce new graduates that are able to meet the demands of an increasingly complex healthcare system.
Thank you, Hugo. Wow, you really practiced it. 1 minute exact. That's good. Okay, I don't see anyone at the mic, so I'm going to call the question. All in favor of the amended motion? Okay, thank you. Any opposed? Okay, thank you. Any abstention? Okay, amended motion is carried. Thank you. Now we're going to call the question for the resolution as amended. All in favor? Thank you. Any opposed? Okay, abstention? Okay, thank you. The resolution is carried as amended. Resolution number 17.
Resolution 17, Strategy to Address Prescribed Drug Dependence, Withdrawal, and Harm, submitted by Joanne McKay-Barrin. Therefore, it be resolved that RNAO advocate that the Ministry of Health develop and fund a national and provincial strategy addressing prescribed drug dependence, withdrawal, and harm that optimizes prescribing practices by considering a safer non-drug alternatives, reviewing long-term use of psychotropic drugs, and requiring a high standard for informed consent, adequate education and training of healthcare professionals, and creation of clinical support services to assist individuals with deprescribing, management, and treatment of dependence, withdrawal, and adverse drug reactions. Therefore, be it further resolved that the RNAO advocate for inclusion of education on prescribed drug dependence, withdrawal, and associated harm in nursing and nurse practitioner school curriculum.
Thank you, Sue. Now, can we have a mover?
Janet Hunt, Middlesex Elgin.
A seconder, please.
Janet Poole, Middlesex Elgin, second.
Thank you.
And there is an amendment on the table.
Are you moving the amendment?
Yes, please.
Yes. So, Janet Hunt?
Sorry. I move the amendment that
Yes.
has been submitted.
Yeah. And can we have a seconder for the amended motion?
Hi, Rachel Woods, Chatham-Kent Chapter. I second.
Thank you. Okay.
Thanks. Over 1 in 5 Canadians are taking psychotropic medications. Prescriptions continue to increase, and people are remaining on these drugs for longer periods of time. Research suggests that many people experience dependence withdrawal and adverse drug reactions associated with these medications, and that for some, these effects can be severe, prolonged, and debilitating. Given how widely these medications are prescribed, this represents a significant and growing public health concern affecting many Canadians. While these medications may help some individuals, there is increasing evidence that their use and discontinuation can lead to tolerance, physical dependence, withdrawal syndromes, functional impairment, and significant psychological and physical harm. Unfortunately, awareness and education surrounding these risks remain limited. Withdrawal and adverse drug reactions are often misunderstood, misdiagnosed, or minimized. As both a registered nurse and a person with lived experience, I felt compelled to bring this resolution forward. I was prescribed domperidone, a dopamine antagonist similar to Haldol, for low milk supply after the birth of my daughter, not for a psychiatric condition. I was never informed of the risk associated with stopping the medication. When I discontinued it, I developed severe symptoms, including akathisia and suicidality. What was happening to me was not recognized as withdrawal or an adverse drug reaction. Instead, I was diagnosed with multiple psychiatric conditions and prescribed additional medications, which have prolonged and complicated my recovery. I have now spent over 2 years tapering off of medications and likely still have years to go. I've had to seek support from experts outside of Canada because appropriate services and clinical guidance are extremely limited here. This resolution is about informed consent, patient safety, evidence-based care, better education for healthcare providers, and access to deprescribing and withdrawal support services. I promised myself that if I survived this experience, I would use it to advocate for change so others would not have to suffer the way I did. I'm asking members to please support this resolution.
Thank you, Joanna.
Elizabeth Strauss-Enright. I want to absolutely speak in favor, especially of the amended resolution, and to say that I absolutely appreciate the intent of the original resolution and the idea behind it. Not only is this the case for those who are prescribed medications like domperidone, but also the very real ways in which especially marginalized communities, especially multiply marginalized communities and individuals have their experiences and practices and behaviors misread and get prescribed psychiatric or psychotropic medications as essentially a method of control. And so I appreciated the original intent. However, at the same time, I just want to surface the concerns that came up that probably partially made this amendment happen was because there was concern surfaced that the notion of deprescribing, there was some concern that we don't want to go down the same pathway with deprescribing psychotropics that happened with opioids, because we saw the very real effects of that. However, I think this is a very real and important starting point, especially as someone who teaches mental health nursing at the undergraduate level, to really center these particular issues and come at this from a very anti-stigma, anti-ableist, anti-Black racism way.
Thank you, Elizabeth. Mike 3.
Hi, I'm Crystal from Waterloo Chapter. I speak in favor of this. I just wanted to say that it's very well done in the sense that, again, a lot of us know about the withdrawal dependence, the trouble with opiates, but psychotropic drugs don't always get the same type of notice. I work as a mental health nurse, a consult liaison nurse in a hospital, and some of my job is literally assessing for this exact type of stuff. Serotonin withdrawal syndrome, serotonin syndrome, akathisia, like all these different symptoms that no one else really seems to understand. Part of my job as a nurse is to help advocate for the rest of my nursing teams. And I think it's just such an important thing to be able to recognize even just the metabolic syndrome that occurs from these medications. It can increase so many other long-term effects. So having, as nurses, being able to be advocates and have that extra curriculum to understand what we're seeing can be really
Thank
helpful
you.
moving forward.
We need to call the question.
Can I just comment for 1 second? The therefore be it resolved statement, that wasn't the amendment that I put in.
Sorry?
That wasn't the amendment that I asked for.
Yeah, we need to call for a vote.
Okay.
Yeah, can we call for a vote? All in favor of the amendment? But is this the one?
No.
No? Which is the one? Siobhan? No. She said this is not the amendment.
It's not the one. Basically, it was the same. I was just adding in that collaboration with interprofessional collaboration with
So the previous
pharmacist
one?
and, no, not this one. Like the one before, the main one, and then it was to add in interprofessional
You
collaboration.
did you email it to Siobhan?
I did, yeah.
Okay, can you just read what you want, like how you want it? Do you
Okay.
remember? Yeah? I tried to save time here.
Okay. So therefore be it resolved that the Registered Nurses Association of Ontario advocate that the Ministries of Health develop and fund a national and provincial strategy addressing prescribed drug dependence, withdrawal, and harm through interprofessional collaboration among nurses, pharmacists, physicians, and other relevant healthcare professionals that optimizes prescribing practices by considering safer non-drug alternatives, reviewing long-term use of psychotropic drugs, and requiring a high standard for informed consent, adequate education and training of healthcare professionals, and the creation of clinical support services to assist individuals with deprescribing, management, and treatment of dependence, withdrawal, and adverse drug reactions.
Okay, so
I
you
support the amendment.
support the amendment.
Thank you. You gave me that.
I think it was already supported. Okay, so support the amendment, and so that's the amended motion that you just called for, and you support the amended, and then can we have a seconder?
Well, that's
Oh, that's one. Okay, so we're just going to call the vote. All in favor of the amended? Okay, thank you. Against? Opposed? And abstain? Oh, abstention? I'm sorry. Abstention? No? The amended motion is carried. Now, we are going to call the question for the resolution as amended. All in favor? One last time. Thank you. Opposed? Any abstention? No? Carried as amended. Friends, this concludes the consultation session, and you can't believe how relieved I am, more than you guys. So thank you to Betty, who had to leave a little earlier, and of course my partner in crime, Sue Lebeau, who stepped in right away, and the Resolutions Committee, and to our parliamentarian, Dr. Claudette Holloway, and to all our consultative reps for committing to attend the AGM and participate in this important and invigorating process. Most importantly, deep gratitude to all the submitters and all the people who stood at the mic to ask questions, to support, and to be there. Thank you. Yeah, the meeting is not over yet. You got to listen to my last address. No. We will now move on to the next agenda item. Before we welcome our incoming board of directors, let's please take a moment to thank our outgoing board members. As I call each of your names, please stand to be recognized. Kathleen Picard, Region 8 Representative. Dr. Cruz, Edward Cruz, representative of the interest group. Yeah, he's already out. And Hugo Tam, student representative. The time, commitment, hard work, and inspiring engagement each of these colleagues of mine have put into our association is invaluable, and it has been a privilege to work with all of you for the past several years. On behalf of RNAO, we thank you all deeply for your exemplary dedication and active participation on RNAO's board of directors. We look forward to continuing to work with you as members or as executives. I have heard from you say many times that your volunteer commitment with RNAO is not done. So we are not done. Never say never. I would now like to present our new board of directors for 2026-2027. It includes new and returning directors, and I will call on each member of the board to stand and be recognized. Our incoming president, Sue Labo. Immediate past president, that's going to be me. Thank you, thank you. Region 2 representative, Huda Muhammad. Region 3 representative, Ashley Fry O'Rourke. Region 4 representative, Poonam Sharma. Region 5 representative, Laliza Turner. Region 6 representative, Derek Hutchinson. Region 7 representative, Sonia Chin. Region 8 representative, Leanne Lobo, she's there somewhere. Region 9 representative, NP Devalohachu. Region 10 representative, Dania Vasai. Region 11 representative, Adrian Capps. Region 12 representative, Dr. Michael Scarcello. Representatives of the interest group chairs, Una Ferguson and Rob Samalak. Where is he? Student representative, Matthew Mark. Please stand. Public representative, Dr. Tecumseh Ed Connors, our knowledge keeper, and our chief executive officer, Dr. Doris Grinspan. Congratulations. We look forward to working together over the next year for our members and for Ontarians, and to continue to shine and grow RNAO as together as a collective strength. Thank you. And now for my last president remarks. After today, I think I'm kind of relieved. So, dear members, you know I might choke a little bit with emotion, so just be okay with that. So this is my time to deliver my final remarks as your proud president of the Registered Nurses Association of Ontario. Serving as your representative on the RNAO Board of Directors has been the greatest privilege and absolute honor of my professional life. I stand before you today here, filled with the profound pride as we commemorate the 101st Annual General Meeting of the extraordinary association that we are all part of. My tenure as your president has been defined by moments of intense pride, deep affection, a sense of belonging, and a true camaraderie with all of you. I have had the incredible privilege to meet our colleague RNAO members across the province, and I've been deeply, deeply inspired by each one of you and your fierce dedication to RNAO's mission. In particular, I must highlight my memorable visit to the Pikanjikam community. It was there that RNAO, under the visionary guidance of Dr. Doris Grinspan, coordinated a very crucial and critical visit with the Ministry of Health to launch the electronic record system for the local health center. During that visit, I was profoundly shocked to learn that the community has continued to survive, and I say survive, without clean running tap water for the last 30 years. Yes, I was shocked, but I was equally inspired by the relentless work of the nurses, physicians, and the medical teams. The resilience of this community, working hand in hand for the health and well-being of the Indigenous members, is something that I will carry on with me forever. In addition, I've had the unique privilege of being part of our historic 100th AGM. Who gets that? One in a lifetime. right? Maybe in another universe. Equally meaningful for me was partaking in the celebration marking our CEO, Dr. Doris Grinspin's completing 30 years of unwavering service to this organization, the nursing profession, and global humanity. Her fierce leadership, advocacy, dedication, and vision for equitable health has woven into the very fabric of RNO. She continues to inspire me alongside many of my nursing colleagues and leaders every single day. I have seen firsthand the intense, relentless work that RNO performs and continues to do so on behalf of their members, for nurses, for health professionals, and for the public. As you heard from our CEO in her report this morning, RNO's trajectory is one of unwavering commitment, swift action, and measurable impact, and we should all be proud of that. Over the past year alone, we have achieved monumental milestones together. As a practicing nurse practitioner, the presidency has allowed me to connect the dots between what it means to be a frontline worker and how we can relate it to systemic policy. I saw firsthand how information gathered from our raw interaction with patients and families directly shapes legislative changes. This feedback, it fuels our advocacy for the health system transformation, not only individual but collectively. RNO has long been a driving force behind advancing evidence-based practice, strengthening universal healthcare, pursuing equity and reconciliation, and championing the social and environmental determinants of health. I'm particularly proud of the historic launch of the first ever best practice guideline on anti-Black racism in nursing in February 2026, and I was there too. Through groundbreaking policy reports, global leadership in best practice guidelines, or the fierce defense of publicly funded, not-for-profit care, RNO has earned its rightful place among the most respected professional associations globally. We must be deeply proud of the contributions that we have done as an organization. We remain at the vanguard of nursing excellence, evidence-informed healthcare, and courageous advocacy. This organization speaks out for nursing and public health, an immense conviction and tangible results. RNO does not shy away from difficult topics, and we all know that. We are revered by provincial, national, and international organizations as a fearless entity that defends evidence and truth on the fundamental principles of equity, diversity, and inclusion, and health for all. What resonates most is our clarity of vision, of purpose. At every turn, RNO brings a sharp focus to equity, evidence, and the people we serve. We talked about the critical investment in primary care, and long before it was popular to do so, and we all know that, ECHO 1.0 came in 2012, and now ECHO 4.0 reports in 2025, and the government is now saying what we said in 2012. So we have shaped legislation, expanded access to care, and improved health outcomes by placing NPs and RNs at the center of solutions. In every initiative, from long-term care reform to harm reduction and climate action, the association holds firm to the vision of social justice and compassion. Our 2026 AGM theme, building on our legacy, nurses powering the future, is our directive moving forwards. We possess a legacy that speaks truth to power fearlessly. In doing so, we all must ensure that nurses remain at the center of any discussion of any healthcare sphere as its core backbone, and that no one is left behind. I see RNO moving ahead as an unstoppable force, advocating fearlessly for our patients, families, and global health equity under the leadership of Dr. Doris Greenspan, and now our incoming president, President Sue Labo, soon to be. At this moment, I must pause to offer my heartfelt thanks. I think it is really important to acknowledge the people who build you up. To Dr. Doris Greenspan, RNA's extraordinary CEO, your vision, expertise, and transformational leadership are unmatched. So let's not talk about retirement. I've been privileged to share this space with you and learn from you. Your dedication, kindness, and practice of leading from heart will always guide my leadership philosophy, and it will remain very close to my heart. Thank you to Sue Labo, our incoming president, for your camaraderie, for your affection, and just friendship. And thank you to the board of directors. We've had a few laughs, more laughs, and serious discussions, but we've always stayed focused on what we want to do. And I'm sure Sue will guide the board with a visionary force and a firm commitment to the value of the organization. I'll be right by you. To my mentors and colleagues, Dr. Angela Cooper-Brathwaite, Dr. Claudette Holloway, Morgan Hofart, Rhonda Seidman-Carlson, Una Ferguson, and many more in this room that I'm not able to name. Your vision, your love, your wisdom, your mentorship, your babysitting for my kids while I was in the meeting, they has all allowed me to grow and participate and flourish. I have drawn immense strength from my lived experience as the eldest daughter of Tibetan parents who were refugees. I'm not going to cry. No, they were brave enough. Thank you. They were brave enough to walk with my grandparents through the treacherous landscapes to find safety and a better life for their family. Their ultimate bravery and resilience to work towards a higher purpose of life has continued to inspire me to, don't cry, to always speak the truth and possess the courage to rise again whenever I fall. At this time, I want to remember my late father, who wanted a son, but I was better. Who would have been so proud to see this moment. And I thank my beloved family, my mom, who many of you know, she's an honorary RNA member. My husband, who's invisible here, but doing something somewhere else. And my 4 boys, who you saw running around. They are all my anchors and my indispensable support system. You remind me daily why it matters to fight for social justice and why it matters to be conscientious and why it matters to work collectively for a better future for all. Special mention to my director at Lake Ridge and the leadership that has allowed me and support me in my leadership journey. And I say, when you talked about your clinical manager and your clinical educators coming here to support you, this is all what we need. We need to support each other. And lastly, I just want to mention and emphasize that representation matters. It is my deepest hope that seeing me serve as the president of RNAO from a Tibetan background and doing a good job at it will inspire many more nurses and leaders who look like me and feel like me to confidently inspire and achieve whatever their heart desires. Thank you, each and every one of you, for this amazing journey, for the heart, the mind, and commitment you bring to the association. Thank you for standing with RNU. Together, we are all powerful together. Thank you. One other property I have is I cry easily.
That's not true. She cries when she needs to cry. Yes, if she would cry easily, she would cry with the politician that she sees. Now I make you laugh, you see?
Yeah.
What can I say? Words of what this woman, amazingly strong woman, You know, I said to someone else that cried, that was a guy yesterday, he said, oh, I'm crying. John Fraser. I said, it's good. When you feel deeply, which you always do, and sometimes even more, it's good if you cry. And I mean, every day we find something else that we have in common. I don't think I ever told you my father wanted also
son?
a boy.
Oh.
Well, I was the fourth girl.
I think we need to break that ceiling and that.
It was broken. He also ended up very proud. But values, what values this lady has of social justice, a role model for anyone. And her humility is something for all of us to learn. A tremendous, tremendous humility. In fact, I already know that many of the Tibetan nurses that you saw a large group of them, or Tibetan young kids that danced yesterday, and I needed to lie.
That was a surprise.
Well, I wrote something else in her. Poor staff was getting confused. And she was like, it is beautiful when someone that, and Lamo said that she never had such a celebration when she started with the Tibetan art culture. And yesterday we gave it again to you.
Yes.
And I wish we will give you every time. So it's difficult to depart. I know that we have Sue, and we will have lots of fun and lots of journey and hard work. It's difficult to depart from someone that you feel very much like a sister in many ways. But you're not gone, you know. Look at Claudette.
She's sitting right there.
Look at Claudette. Where is Angelita? Look at Angelita. You saw Imagine showing up here.
Yeah.
Morgan ended up working at Areneo. You know, you just don't let them go, ever. Because when someone has your qualities, Lamo, of speaking truth to power in a very humble way as you do, and yet with so much sturdiness and so much conviction, you don't need to speak it loudly, and you don't need to speak it. Your words speak more than anything else, and stay with people forever. So keep being a role model for us, not only for the Tibetan nurses, which
Yes.
you will, or young kids. Now, Morgan, that's where we need to get her involved also, and her mother, when she will come to visit for 1 year, she stays, to go and talk with the kids in school, in your school that you go in the weekends, and convince them to be nurses like you, because they have a tremendous role model in you. And my gosh, the more the better with the values that you have. So thank you from all of us. You saw every single member here standing up for you. And Sue,
I get the orchid this time.
yes,
Thank you.
yes.
Thank you.
And Claudette asked me at the office, so did Michelle, quite frankly, Michelle Rangel, do you want me to bring the pin? No, I said, I want to bring it myself because we'll be safe, and I will bring it for sure. It's in the closet, it's in the safe, because I'm not letting her go so easy. So you will get it next year with another speech here. That's that, because we like those speeches of you.
Yeah, thank you.
I have it though, but I'm not going to give it to you. I think I did the same with Morgan, by the way.
My treasure is with you. It's good. And thank you, everyone. It's been an amazing ride, and it's been amazing. And I think we should all be proud that we're all together. And when we talk about RNU being the home, this is exactly what it is. So now it's my great...
No, not yet. Not yet. You see, you said to everybody we need to support one another. So Claudette very kindly says, do you want to borrow mine? No, I'm not borrowing, I'm taking it. Because it actually has a lot more meaning, because you are a mentor too.
Yes.
So I'm going to give you the other one. Huh? And this one, Madam President, you need to pin it. And where is the picture?
See, I was just getting on my job.
Oh, my dear friend.
You know, Sue said my boys are handsome, and she has 2 girls. Yes. Never know what's going to happen there.
Maybe you won't be done with me yet.
Okay. You can tell them. Wait, she needs to say something important, so you don't lose it. We cannot give you another one.
Good evening, members. Just to say that we all need to wear our RN pins for the branding, but the past president's pin is very important. Don't lose it. NP Lama Dalkar, 18 karat gold. 18 karat gold.
And a diamond.
And a diamond.
And we say it for real, because I don't know if Jennifer Yoon is here still. Jennifer, I don't know if you know the story with our beloved Vanessa. So I get this phone call. No, I actually didn't get the phone call. This was a week before she was saying goodbye, when I went to visit her. And she goes, you know my president pin? I go, what about that? I have that N pins. I can give you N pins. PPSO pins. She was PPSO also. No, my president pin, that one that I got. I go, what about that, Vanessa? I don't know where it is, and I want to go with it. And she got a second pin. But whoever is here in earth, don't lose it, because I ain't going to give you a second one.
My God, that's too much pressure now.
It's true, Vanessa, I got it.
Thank you. I didn't realize. I just looked at it. There is a diamond. Like I said, shine bright like a diamond. Okay, so thank you everyone. Now it's my great pleasure to present to you your new president for 2026-2028, and to officially pass the gavel to Sue Labo.
Oh my, wow.
She gets to do the gavel now.
Bonjour, Niji na nandawe I je wejig. Hello to my fellow nurses and healers. Bonjour, chers collègues infirmières et infirmiers. You know, as I smell this sage, this is like coming home. They say that friends are the family we choose, and as a nurse practitioner early on, I had the privilege to work in an Indigenous Friendship Center, and we'd often start our day with a smudge, and this brings me back to that time. Thank you. It is an honor and a privilege to greet you today and to begin my contribution to our vibrant nursing profession as RNAO's 60th president. We are here today on the traditional territory of the First Nations, Inuit, and Métis peoples across Ontario. I honor their deep connection to this land and acknowledge the importance of their history, of walking together in the present and of building the future together. I appreciate RNAO's strong commitment to advancing truth and reconciliation, equity, and culturally safe care to all Indigenous peoples. As nurses and health advocates, we have a responsibility to tangibly and meaningfully act, guided by Indigenous people, to support and celebrate the rich ways of knowing, being, and doing. We, me included, still have much to learn. None of us achieve what we do without connection and collaboration with others. Nurses profoundly embody this as we partner with patients and foster their well-being through connections with their family, care partners, care and service providers within and beyond our healthcare system. We nurses also benefit from such relationships through work and learning environments, family, and friends. My personal and professional life have been enriched by so many of these relationships. I'm grateful to my husband, Rick, my bestie, who has cheered me on throughout my career and encouraged me to stretch. To my teen daughters, Savannah and Tangi, who bring sunshine to my life as I watch them blossom into thoughtful, brilliant young women who will make a positive impact on this world. None of them are becoming nurses, though. To my dear and longtime friends, including a few who are nurses and NPs, Debbie Kutsu, Christine Gignac, Tangi Ing, Danielle Baker, and George Van Slyke, as well as my two sisters, José and Elaine, and my parents. Thank you for lending your ears and your candid words. To my mentor, Nancy Jacko, she was a nurse's nurse, a developer of so many talented leaders. I miss and appreciate her so much as her wisdom continues to echo in my words and actions. To Dr. Doris Grinspan, who has been a treasured and inspiring influence since my first days as a nurse, and who showed me how to harness the power of political action to advance nursing. To past President Lamo Dalkar, who exemplifies RNAO's values and kindness through her sage and ethical leadership. I'm so grateful that we will continue to journey together and you will continue to mentor me. To you, my fellow RNAO members who represent the many nurses with whom I've lived and laughed and learned. To all of you, my heartfelt gratitude and appreciation. I hope that each of you gathered here today have such wonderful people in your lives and that you will find many of these supporters right here in this room. Building on our legacy, nurses powering the future. What do you see, hear, and feel as you reflect on these words? How might you impact the future of patients, communities, and systems? How might you use your voice to speak up for equity and, most importantly, open up space for others to share their voices and experiences? How might you make a positive and sustainable difference to political and ecological environments? How might you? These are words of possibility, of stretching boundaries, of imagination and innovation. So how might you build on our legacy of trust and action to power the future? How about recognizing and actively addressing the challenging times in which we live? We nurses have the capability and knowledge to do this together. Our advances in equity, diversity, and inclusion must be safely vigorously safeguarded and built upon. We must fight to heal our Gaia, our Mother Earth, who is showing serious symptoms of humans' mistreatment. We must advocate and act to support those who, temporarily or not, cannot do it for themselves. And we must blaze forward, creating new knowledge to guide healthcare practices and continue sharing this knowledge generously. As we have done in our RNAO home office, we must provide safe, supportive, and welcoming spaces for conversation and positive action. As nurses, we are well equipped to do this. I invite you to take to heart these calls to action, to act in the present and journey together in the future. I look forward to hearing your stories of action and to celebrating, like we did today, the difference that we make to people the world over. And I am thrilled for this opportunity to contribute as I lead our board and RNAO to power our future together. Chi miigwech. Thank you very much. Merci beaucoup. I guess I have official work now. Yes, you are, and you always will. I would like now to thank everyone for attending this year's AGM. I would especially like to thank the following people for helping to make this AGM such an incredible success. The Windsor chapter and Kathy Moreland for her enthusiastic hosting of this year's AGM. Thanks to you, I can do the hustle, kind of, sort of. Dr. Claudette Holloway, our excellent parliamentarian and another mentor. May Tao, our dedicated chief scrutineer, who did a fab job. To all the dedicated scrutineer volunteers today, Dion Sinclair, Valerie Fissette, and Crystal McCallum. And to all our awesome volunteers, you know who we are. You are. Huge thanks from all of us to the following staff for their heavy lifting in making this AGM a smashing success. Dr. Ishana Biradwa, Director of Information Management Technology, for taking on the overall coordination of the 101st year AGM. Thank you for making it so smooth. Marian Zeik, Director of Communications, and her fabulous team. Wanya, Director of Finance and Administration, and her amazing team. Morgan Hoffart, Director of Membership, and her stellar team, and also a mentor to me. Thank you also to Carrie Edwards. Dr. Michelle Ray, yes. Dr. Michelle Ray, Director of International Affairs and Best Practice Guidelines, and her stellar team. And of course, our inspiring CEO and her three maestros, Siobhan Cordell, Board Affairs Extraordinaire, Shannon Holcomb for her diligent work and gentleness, and Michelle Rangel, Executive Assistants, for her incredible and tireless attentiveness. Yeah.
You know, also coffee now.
Well, coffee too, apparently, and meals and a whole bunch of other things. Many RNAO staff members contributed to this AGM, and I want to give special thanks to the following. Carrie Edwards, Judy Liu, Bedu Lucena, Leanne McCartney, Mitarshan Najan, Lauren Nicol, Valerie Sergnis, Sitali Singh, Mike Watson, and Raul Pinto. Thanks go to all the RNAO staff who are here today and those who remained at RNAO home office to continue to serve our 5,700, 250 plus members. And Marian G.
she's there.
Oh,
and
there.
her amazing team that is also helping with resolutions.
Marion, thank you. Delivering such a spectacular AGM takes months of dedicated and detailed work, and the results speak for themselves. You are all a 10 plus, 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 plus. Thank you, everyone, for being a part of this AGM and sharing your energy, enthusiasm, commitment, and passion. We are all stronger for it. We acknowledge and thank our corporate sponsors. We are also pleased to acknowledge Access Insurance Managers as a valued corporate sponsor and the insurance broker for our professional liability protection program, whose trusted expertise helps safeguard and support RNAO members across the province. RNAO is proud to recognize Hub International Ontario ULC as the sponsor of the AGM opening ceremonies, helping bring members together to celebrate leadership and advance the profession as our trusted home and auto insurance partner. Hub continues to demonstrate a strong and ongoing commitment to supporting you, our members. RBC Harbour Group is proudly supporting RNAO's 101st anniversary as the opening ceremony sponsor, demonstrating their commitment to advancing and celebrating registered nurses in Ontario. Evaluations this year will be completed online. The link to the online survey can be readily accessed on our RNAO website. We do take the feedback very seriously, so please take the time to share your wisdom, share your words, make your voice heard. Come online and complete your evaluations. On the screen right now is the link. You will also receive an email following the AGM with the survey link. Those who fill the survey will receive a certificate of participation to our 101st AGM. A reminder as well for the environment, please drop off your plastic badge holder in the boxes just outside the door as you leave. We do reuse them. And as you exit this ballroom, I and our 2026 and 27 Board of Director members will form a receiving line in the foyer so that you have the opportunity, and we have the opportunity, to meet you. Before I introduce our Indigenous closing, I will ask for a motion to close the Registered Nurses Association of Ontario's 101st Annual General Meeting.
But before that, we do the
Well, thank you. Thank you.
You can be seconded. You can be moved.
All right, so I need a motion to close the meeting.
Dr. Rosemary Irish, York Region.
Thank you.
I move the motion.
Paul Emmanuel, in case no one remembers, South Simcoe chapter. I so second.
Thank you, Rosemary.
Let's start the
and Paula.
party.
So I now call this meeting to a close.